start out with introductions. I want to say Leah has a new assistant, Brian Christensen. Yep. And welcome. Thank you. And we've got some people that have come to join us today from Iron County and USEAP County. Is that right?
Yes.
Okay, so we're going to go around and have everybody just say your name and who you represent on the panel. I'm Karen Condor. I am the chairman, and I represent parents of students with disabilities.
Roy Barrington, Joab School District Assistant Superintendent, Special Ed Director.
Kevin Garrett, Director of Special Programs in Iron County School District.
Christina Kamara, Regional Director, North for Spectrum Academy, and I represent LEAs.
Carrie Warsky, I have a daughter with Down syndrome. I'm also an SOP for Canyon School District Early Childhood.
Emma Borman, I represent teachers of students with disabilities.
Shelley Halverson, I'm a Special Ed Director at Salt Lake City School District.
I'm Michelle Marquis, I'm a Special Education Study at Disability Law Center.
I'm Katie Cox, I'm a staff attorney at the Disability Law Center.
I'm Teresa Davenport, Early Childhood Special Education Specialist with the Utah State Board of Education, so I represent early childhood at CEPAR.
I'm Tiffany Bryant, I am a parent of a child with disabilities.
I'm Aileen Goon, and I'm with the Utah State Office of Rehabilitation, otherwise known as Vocational Rehabilitation.
I'm Michelle Searle, and I represent private schools, including residential day treatment facilities.
Stephen Phelps, I'm a parent of a student with disabilities.
My name is Elliot Howell, I am an individual with a disability.
I'm Jennifer Howell, and representing parents of students with disabilities.
I'm Carla Sterling, representing parents of students with disabilities.
Amanda Longwell, parent of a student with a disability.
Trenton Nelson, parent with a student with disability.
I'm Brian Christensen. I work for the Utah State Board of Education, and I'm an administrative assistant for Lead Works.
We're so excited to have Brian. So he'll be facilitating USEAP meetings from now on. Where he's assistant superintendent at the state board and the board's liaison to the special education panel.
Okay, and just want to remind you, we're being recorded, and the microphone is here in the middle, so speak up so that can pick us up. Okay, and we have anybody else that came in after we started around?
Mallory Poole, teacher with special education.
And Michelle Sanchez, sorry, with JJS, Juvenile Justice Services.
And Allison White, who's a teacher as well, she had to run over to the USB to do a quick presentation for special ed directors, for new special ed directors, and then she'll be right back. So,
Okay, thanks. Just want to mention, I sent the finalized memo from our last meeting to Leah this morning, and I believe she just emailed it to everyone. So that will go into the state board. So our topic today is social emotional learning, and we're going to start off with Leah is going to give us a definition and support activities overview.
okay, so thank you very much. The State Board of Education has been, for the last year or so, has been having quite a few discussions about social emotional learning and how to better support students when it comes to all of the different factors that we consider in social emotional learning. And the state board did not actually have a definition until just a couple months ago. There's been a lot of controversy in education in Utah and in other more conservative states for the last few years about the role of schools in social emotional learning because there are parents and advocacy groups who believe that social emotional learning should happen at home, not in schools, that schools are just about academics. Unfortunately, in our schools in the last few years, we've had some pretty serious events, school shootings, and suicides, a dramatic, significant increase. The amount of anxiety that's being demonstrated by children in schools, the amount of depression, the base trauma that students are bringing to schools has increased dramatically, and as a result, the school board has been struggling for the last couple of years to really come to consensus about what the role of schools is when it comes to social emotional learning for students. And so our board, 15 elected board members, have had lots of discussions about what the definition is and what the role of schools is, what the role of policymakers is, what the role of the community stakeholders is. So just a couple months ago, the state board did finally pass a definition of social emotional learning. It's based on the CASEL definition, which is the Collaborative for Academic, Social, and Emotional Learning, which is a national organization focused on really improving not just the mental health, but the communication skills, the social skills of children, youth, adults, families, and works quite a bit in schools. So the definition that we are currently using is social and emotional learning is the process through which children and adults understand and manage emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, self-advocate, and make responsible decisions. So those are kind of the criteria by which the work at the state board is happening. Now, of course, all school districts and charter schools can adopt their own definitions and design and implement their own work related to social emotional learning based on their context. And we're really lucky because we're going to have two school districts present today the work that they are doing, which is really out in the forefront of the work that's happening in Utah and in many other states. So we'll get to hear from Iron and USEAP, which I'm really excited for you to hear about the cool things that they are doing and the direction that their communities are choosing to go. So a couple other of the things that are happening in our state. So first of all, social emotional learning is one of the priorities of the governor. So the governor's office has been providing professional learning, has been getting people together to talk about social emotional learning for the past couple of years, and it's been one of the major focuses of the education specialists in the governor's office, Tammy Piper and Karen Peterson, and they have put together an SEL team, state team actually. One of the individuals in our office, Jerry Sagers, who's a school counselor and is on my team. She's participating on that state team. There's an administrator from Davis School District, someone from the governor's office. There's someone from the Division of Substance Abuse and Mental Health. It's a cross-section team that will be looking at the implementation of social emotional learning statewide, not just in schools, obviously. So that's a major focus, and just in fact earlier this week, the governor had a summit and invited individuals related to education from P through 20, so higher ed was also at the table, to talk about the needs of our students from young to through college, and what we as a state might want to talk about in continuing discussions about social emotional learning. The legislature is also very invested. Legislators are also very invested in social emotional learning and specifically in mental health, in prevention and intervention when it comes to mental health. And so there have been several bills proposed and a few passed in the last couple years related to improving the outcomes for students, children, youth, individuals, families, communities. One really important one passed last session, House Bill 373, which the title is School-Based Mental Health, was a bill that had a pretty huge fiscal note. $12 million to start, $26 million, it was $16 million to start, and 12 of it came to the State Board of Education, and $26 million ongoing that would start this next fiscal year and hopefully continue to increase the number of qualified personnel, that's the language of the bill, qualified personnel providing school-based mental health services. So the qualified personnel include school counselors, school social workers, school psychologists, nurses, social workers who aren't school social workers but who are licensed through DOPL, and psychologists who are also licensed through DOPL to provide preventative and intervention and even postvention services to students in schools. The cool thing about the school-based mental health statute now, at the time, House Bill 373, but now statute, is that there's a provision for working with local mental health agencies. So districts and charter schools who chose or who choose to collaborate with local mental health authorities actually have an opportunity to get a little bit more money. And so some, and you'll get to hear that from our guest today, some counties, some school districts are already working with their local mental health authorities, and so because of these examples, Representative Elison, who is the sponsor of this particular bill, really wanted to encourage and scale up the coordination between agencies, which is one of the really cool things that happens at this table, because we have such a wide range of individuals who serve on the panel, and so you get to know each other. You get to learn what agencies and schools do, and a lot of really cool collaboration has happened just because of this panel, because we've been able to get to know one another across agencies, and be able to help and support one another. And Representative Elison is hoping that happens as a result of this money. So that's one of the important things that's happening. The downsides that we have heard about from that particular bill was that school districts and charter schools had to provide a match in order to get the money. So some school districts and charter schools were not able to match as much as they were eligible to receive. So they weren't able to get as much money as they could have because they couldn't match it. The majority were able to, but we had 2 school districts that chose not to participate, and we had quite a few charter schools that chose not to participate. And the feedback that we heard, it was one of the school districts chose not to participate because they were having a change in leadership, and they needed to come up with a plan first, and then they would apply this year. And we hope that happens. But the rest of the feedback we heard was that the LEAs had a hard time coming up with the match. And now, with the increase in funds this year going from, we sent out about $12 million last year, increasing to more than $20 million, the match also increases. So we'll be talking to districts and charter schools in the next couple of weeks about the amount they are eligible to receive, and finding out whether or not they're able to accept that amount because they can match it.
Can they do a partial amount? Can they say we can match it?
Yeah, yeah. And that's what the ones who couldn't match the entire amount did. So
what happens to the rest of the funds if they don't use it?
So So,
Like,
great
you know,
question.
it's the whole state doesn't use it all.
Yeah, so we send it back out to school districts and charter schools who could match more and who would like to use more of it.
But
So
then does that make the schools that can't afford it?
we reallocate it.
Okay. But then the schools that maybe can't afford it that really need it are kind of suffering? Is that what I'm kind of
Well, they
understanding?
can't use that money.
Okay.
Yeah, but it is possible that there would be a change to the statute, and we'll see what happens this legislative session, because that is the number one piece of feedback that we got.
Is this a stepping stone? I mean, this group has talked about a need for more mental health professionals in schools. Is this a stepping stone saying, here, we're gonna give you some money now, but pretty soon it's gonna be mandatory, you need to have this amount of people in school that are qualified? Do you think it's a stepping stone?
I haven't heard that discussion, but if you saw the press release from the UEA yesterday, they did it. That was actually included in the press release. The press release was about the tax reform bill, but it specifically related to the research that's happened and the outcomes that we've had in the state in the last, it focuses on 20 years, but it really looks at outcomes for the last 10 years, which is the last 2 UEA presidents, because one had 2 terms and now Heidi's in. And one of the things that it talks about is that the number of school counselors, school psychologists, and school social workers that we have in the schools is dramatically, the ratio of adult to student is dramatically lower than the national recommendations. And that year after year after year, education has gone to the legislature to say, hey, our ratios are so dramatically higher, you need to fund providers at a rate that research suggests is appropriate for schools, and that is consistently not happening. Although House Bill 373 was a significant investment in school-based mental health. That's a lot of ongoing money, $26 million.
That's awesome.
But no, I haven't heard specifically about mandating FTE ratios. But there are recommended FTE ratios, and we're not hitting them.
Was that money, could districts use to provide existing, like could they use it to provide existing services, or do they have to expand their services?
They had to expand.
Well, if they were in a year that a school or an LEA had made investments in, they could use that as part of their matching.
Okay,
So they could say, look, we made this investment in the last year, and it looks this way, and it falls under the umbrella of the grant. So we can call that our matching or in-kind funds, and then take that same amount from the new monies in the grant. We were one LEA, but that was the only way we were able to tap into the funds, is because we had happened to have hired a school counselor the year before. But if we would have had to try to do matching funds, we would have been able to budget enough money to capture any of the new monies, because we just didn't have them.
But that isn't actually in the statute. The USBE did that so that LEAs like JUAB could match. So one of the recommendations that the board has made is that the legislators consider amending the statute to actually allow that, because we just did that, right? So that's one major initiative. We have several other really important initiatives. So we have, if you remember last year, at the legislative session, we talked about the school safety bill. One of the board's major priorities for last legislative session, and you'll see it at this legislative session as well, is improvements, capital improvements, which the word capital when it comes to school district and charter school budgets means buildings and anything related to construction, and really not humans, okay? So you have maintenance and operation, humans money, and you have capital money, which is like your buildings and the stuff in your buildings. So the board and many other groups together requested money for school safety, both capital money to improve buildings, to make buildings, facilities safer, and then money for humans to make schools safer. And the money for the humans, most of it was taken out and put in House Bill 373, and the capital was not funded. So the money to give school districts and charter schools to improve their buildings was not funded. So that may be another discussion that comes up, but that is a major priority of the board and of other advocacy groups across the state, that yes, our students definitely need more humans to help them, but they also need to be in buildings that are safe. So that's another focus. Now remember, the definition of social and emotional learning is understand and manage emotions, and that goes to the school-based mental health, prevention, intervention, postvention, okay? Set and achieve positive goals, which isn't necessarily school-based mental health, a part of, but that's way bigger, right? Feel and show empathy, could be part of school-based mental health, but is also bigger. Establish and maintain positive relationships and social skills, which is huge and important. Advocate, which, by the way, the state board added specifically based on a conversation they had related to students with disabilities, that self-advocacy is a major skill for students with disabilities, and other student groups, like refugees, students learning English, but they had a conversation specifically about students with disabilities and added that self-advocacy language. And then make responsible decisions, critical thinking skills, and thinking before you act, those kind of things. So social emotional learning is bigger than just school-based mental health. So a couple other initiatives we have going. We have both an elementary counselor and a secondary counselor and a comprehensive guidance program. We provide funding to school district and charter school comprehensive guidance programs that meet specific requirements and standards that the board has approved. So there's funding to fund not just personnel, but what you need to be able to have a comprehensive guidance program. We have a school safety specialist in our office who works with the school safety center that was established just over a year ago with a bunch of different agencies, advocacy groups. We have the AWARE grant. We applied about a year and a half ago for a federal 5-year grant that we are providing personnel and professional learning opportunities for the personnel for 3 specific school districts, Alpine, Jordan, and Cache, and then professional learning opportunities for school districts and charter schools across the state. And the data that we're looking at specifically that we're targeting is student suicide ideation. So, which this was a big deal that the board approved applying for this federal grant, because until this last iteration of board members were elected, the board as a whole has been opposed to applying for federal funding. And so this was a big deal. And Utah was one of the grantees, and it's quite a bit of money that is flowing into the state to provide professional learning specifically related to reducing suicide ideation, but mental health in general. We also have behavior support initiatives at the State Board of Education. We have 2 behavior support specialists right now, one that works on Tier 1 and Tier 2 behavior interventions, one that works specifically on Tier 3 behavior interventions, students that are very aggressive towards self or others. And we have an entire prevention team now at the State Board of Education. We have substance abuse and prevention, we have bullying prevention, we have human trafficking prevention, sex abuse prevention, child abuse prevention. And in fact, Tanya Albornoz from this committee, who used to represent DCFS, was just hired by the State Board of Education. That's why she's not in the room. She had to resign her position on USEAP. She was just hired by the State Board of Education as one of our prevention specialists. So we're really excited that we have an entire prevention team. One of the other things that the board and the governor's office has been really focusing on jointly is restorative practices. We have a restorative practices specialist, and this afternoon you can see from the agenda we'll hear a little bit about the work that is happening in restorative practices. So Karen and Summer just asked me to give you kind of an overview of what is happening from the board's perspective, the work that we are doing. As a result of House Bill 373, we will be adding next fiscal year, so starting on July 1 of 2020, we'll be adding another position in our office, and we will be looking at getting a school social worker to work on the school-based mental health team. We have school psychologists and school counselors. We don't have a school social worker on that team. So that person will do the same kind of work that our school psychologists and school counselors do, but then we will have a representative from each of the different kinds of mental health providers. So we're really looking forward to that. That's just kind of an overview to tell you like what social emotional learning is and what the board is doing.
Real quickly, I saw a little blurb that talked about maybe for elementary schools on their recess, trying to structure that a little bit more. Is that part of this initiative? We're trying to give some social experience and training and modeling. Is that part of this push?
It's part, but the recess conversation is twofold. It's partly about social emotional learning and teaching kids social skills, but the goal is not that recess is structured. The structured recess is something that is provided to students who are unable to or struggle with being able to occupy themselves and be physical and interact all on their own, right? So the goal is not structured recess. Structured recess is a way to help children take advantage of recess on their own and
so it's not wasted time.
Right, get their physical needs taken care of. That's one of the things that came up and related to that recess conversation. The other thing is the number of minutes and days, hours that students need to be counted as being in school and for funding purposes. And so the one of the big questions on the table was, can recess be counted as instruction time towards the funding formula, or does recess need to be deducted from instruction time? And sometimes recess is some of the most vital instruction that happens during the school day for some kids. So that was part of the discussion as well, because there is a lot of instruction going on at recess at present. But if recess is considered instruction time for all kids, as opposed to that group of kids who need structured recess and need actual instruction about physical health and social skills and critical thinking on the playground, that kind of thing. And there have to be adults there instructing, there have to be adults keeping track. And that means that teachers don't have that 15 minutes or however much of break time twice a day, which is really important to teachers. So that's a complicated conversation because it's multifaceted.
Thank you.
The funding component, I maybe alluded to it earlier, but I'm kind of curious, like with kids with disabilities, my daughter being one of these that have additional medical issues that contribute to increased absences. I'm curious if that kind of penalizes schools in the funding equation, if there isn't, I guess, leniency, that funding calculation for those variables that really isn't.
So if a student has health concerns, there are already the ways for schools to keep track of that, especially if the student has an IEP. But that wasn't necessarily part of the state board's conversation related to recess, but that has definitely been part of the conversation related to the funding formula and specifically related to students with disabilities.
Then what was the, I guess,
so there's a way to account. Yeah, there's a way to account for that for students with disabilities.
I was just curious to ensure that schools aren't penalized whenever we've got that extra.
But part of the recess conversation was about you taking away resource as a way to discipline or penalize students, which is not a great idea because kids need that time, right? So there was a lot of discussion, and there will continue to be discussion, and the board. It's possible that using resource as a discipline, as a consequence.
You're saying resource, do you mean recess?
Sorry. Sorry. Using recess as a penalty the board rule will not allow that. That discussion has been happening, so there seems to be more movement to disallow that than to keep it open, but we'll see.
So that's just kind of a conversation of evolution, right? The state board obviously is leaning towards and not permitting it, but the districts aren't necessarily
right. So it could end up that school districts and charter schools get to make that decision, that it becomes a local decision.
Okay. Is
Shelley?
there a conversation with the board about how social and emotional learning and increased mental health supports in schools can support students with more significant cognitive disabilities? Because that seems to be.
The board has not specifically discussed that. However, we certainly are discussing it with special ed directors. Yeah, and but the board has not specifically discussed it.
I just
but something
that had entered into the conversation.
Yeah, but something you just said reminded me of something they did bring up. Dang it.
Would that be a good point, like in these memos, as we're kind of formulating the memo for this particular discussion, to add that particular suggestion in the next round of, or in the next memo to the board to consider and to discuss? I mean, that seems like a very relevant.
It's certainly something
very important topic.
Nice. That's a big
I think it's critical because that's some stuff happening.
And school-wise, it's like we develop all these things, but then if you're impacted in a certain way, it's still difficult to access those things. It's hard.
Yeah, they definitely deserve access to that and need it.
100%. We need them to have it.
I can make a note of that when we have our discussion, because that was something that I was concerned about too. So good. I'll make sure we bring that up in our discussion.
Leah, can I ask a clarifying point? We're talking about recess because that's sort of an elementary term. How does that impact the secondary school setting where there isn't recess? Are we talking about is lunchtime sort of that sort of time frame? Because I know a lot of schools do so it's just an elementary conversation.
It really is, because the conversation in the secondary is PE. It's, yeah. Good question, thanks.
I wonder, has the board talked about, or could you describe if they are already doing efforts around aligning the transition initiatives around the social skills development, and then also the self-advocacy instruction that's required in the Workforce Investment Act or the amendments in the Rehabilitation Act, and how that's aligned with the efforts for social emotional learning and the prevention teams, and what part rehab counseling has in this?
So the board has not had those specific conversations. Individuals at the state board are certainly having those conversations. Specialists are, the prevention specialists and the transition specialists and the CTE specialists are all talking together about that. And in fact, the social studies specialist, Robert Austin, joined the conversation this week in thinking that since the social studies standards are going to be reviewed, starting this month actually, he's going to bring up with his review committee the conversation of, do we want to look at some of these or all of these items in the definition of social emotional learning in the context of social studies. So as far as the transition conversation is happening, that certainly is happening with specialists. The board itself, I haven't heard them talk about it, but it is happening at the office.
Yeah, the definition aligns, it aligns directly with the federal definition for what's required for transition, the pre-employment transition services specifically. But even for out-of-school youth, when we're thinking about transition either back into the school systems or some kind of, alternative path to completing high school, which hasn't been discussed yet because we're talking about in school, but certainly, those efforts would make sense. It goes right along, and it would bring align then some of the efforts that are happening that are requirements through the federal law that include rehab counseling.
I can speak to that just at the local level because I represent VR, which is mandated to provide pre-eds, but we are providing we have the Transition Institute coming up that we're co-sponsoring with USBE. So we've been working jointly, and we have national experts coming to present to LEAs at the conference on the 5 pre-eds, which is self-advocacy is one of them. But we are partnering a lot at the local level to weave in that social skill development. It doesn't really pre-eds don't really cross over into that emotional piece, but it's more of that social skill development and learning how to work with employers and peers at the workplace. So there are it does weave a little bit, but we are doing a lot at the local level, both at the state level and the local level, to address those things and partner. So we're really excited. Yeah.
I just want to, before we turn over to Kevin, so that we'll also have, we're gonna have the two, just kind of explain how we set up the agenda. Okay, so we have 2 school districts that will be presenting on what they're doing. Then strategic direction director from the State Board of Education is going to come give a short presentation on Utah's Portrait of a Graduate, which I think will really help you frame how the work at the State Board is oriented and where social emotional learning fits in the work that the State Board is doing. Then Christy Walker, the coordinator of the Safe and Healthy Schools team, is going to come later and give a short presentation on the work of the Safe and Healthy Schools team. Some of it I gave you a little overview of. And then after lunch, because he wasn't available, we'll break up your conversation a little bit with a short presentation by Brian Olmstead, the coordinator of the prevention team, to come and talk to you about restorative practices, which was a specific request from your priorities setting meeting. If you remember back, that was specifically on the board, restorative practices. So anyway.
Okay. So we want to try to stay on our schedule. We've got a really full schedule day. We do have time this afternoon that we'll be talking about what we want to include in our memo. I don't want to say don't ask questions. We want to be careful with our questions, so we're listening to our specialists and getting the information that we need to. We want to thank the representatives from USEAP and Iron for coming all the way to come present to us. So I'm going to turn the time over to Kevin Garrett from Iron County School District.
Yeah, whatever we can move to, Kevin. Yeah.
What's easier? Honestly.
projector is,
Yeah.
so this one, show Mary. This one's on his display, like he doesn't have an arrangement of this option.
Do you need to email it to me?
Did something.
It's like,
Yeah, but we plugged Royd's in this morning and it worked fine, so. We did a little test, but
Is that it? Is every computer's different?
yes, every.
so the thing is, you know,
Did yours work? I can start, I'll just email it to someone and I can start.
Yeah.
if you want to email it tomorrow, then I think just.
And then just stay plugged in. Yeah, that would work.
Do that, and then we can.
Technology, it's awesome, until it's not. Jump on
Oh, okay.
I'm in my email, I don't think everybody needs it.
Why not?
It needs on my email. Just go ahead.
We'll get us up and running. Sorry about that. First of all, let me apologize. I typically don't go anywhere without a tie. And I had a training. I was actually up here on Tuesday to the governor's meetings. And so I drove back, had trainings for our district yesterday. And that went till about 5 o'clock last night. And so I hurried home, got everything put together except for the tie. And then got up here about 9:30 last night and just didn't want to go out and buy one. So I apologize, first of all, for that. I typically don't roll this way. So anyway, hopefully it won't be too big of a distraction for you. First of all, my name's Kevin Garrett. I'm the Director of Special Programs in the Iron County School District. I've been in education now for about 30 years. This is my 30th year, which, as I look back on that, I think, wow, that went by pretty fast. I spent 12 years as a special education teacher at a high school, and 11 years as a secondary principal at the high school down there in Cedar City, Cedar High School. And then the last 7 years I've been in the district office as the special programs director, which includes special education, 504s.
It's on your desktop.
Yeah, it's on my desktop.
What's it called?
And ESL. Anyway, just a little bit about kind of our district. We're a district of about 10,000 students. We're coming up close to that mark where we have to increase our board members. And so I think we're hovering right around about 9,600 or 9,700 students in our district. So we're growing, not as quickly as Washington County is growing, but we are growing a little bit. And I'll get into this a little bit as we go, and I may have to adjust a little bit on my slides, but when I came into the position as the special programs director, we actually had 2 school psychologists that were working with us in the district, and And we didn't have, we had a couple of counselors in the secondary schools, and we had counselors in every other elementary school. They'd share, they were part-time in each elementary school. And one of my goals as the director was to increase our help for our students in those areas. And so I quickly started to look for school psychologists to help with assessments and things like that with our special needs students. And as Leah knows, school psychologists are really, really hard to find. We're now finally up to 5, but we've had to tap into the new program the state's using as far as not school psychologists, but people to assess. And it's a program that they have through Texas. And I can't remember really the name of the
Special
license.
education eligibility evaluation.
That's what we've done with 2 of our students. So we now have 5 that we're able to use in our district to be able to reach the numbers of assessments that we need to reach in our district. So we've been able to do that. The one thing too is as we've approached this social and emotional learning is we wanted to have social workers, access to social workers for all of our students. And this is a work in progress, let me tell you, because right now we're sitting at 7 social workers in our district where we had 0 3 years ago. So we've been able to put 7 in our district, which is amazing. Now we're trying to put 2 more in, but we can't find them. We have no one that's applying for our position. So another thing the state needs to.
That was the thing that Shelley's comment reminded me. No matter how much money is available, if the people to fill the job are not available, it doesn't matter.
Yes. So that's the part we're having. We've had an open position now for almost 5 months where we have not been able to find a social worker to fill that position. So actually the money's there and waiting, and it's that grant, not the grant, but the money that the legislature put towards that bill and towards mental health that we're trying to utilize, but we can't find people to actually take the positions. And so that's another challenge. But really what's happened is we've been able to increase that need for mental health help for our students. You know, one of the things I think that I wanted to bring out too was, as a teacher, sometimes, you know, we don't get to see what goes on in students' lives. We just have to take for, you know, what the principal tells us, what the parents tells us as gospel as far as these students. And one of the things that I was able to do as a principal is I got to go to staffing meetings, and I got to see those things that went on in those students' lives. And because of privacy laws and things like that, we can't share that with our teachers. And so as a principal, I had to go back and say, listen, you guys, just know and understand that these kids are struggling, these kids are having a hard time, and they're really having some challenges that they're going through that they need to have our compassion and need to have our understanding. And so without having to share that with them, but I don't think the real impact was felt because they really didn't know or didn't see what was happening to those students or what was going on in their lives. And so anyway, we'll go ahead and start now that thank you for helping me there. I want to start right out of the bat, and I guess we kind of talked about this with Leah, but what comes to mind to you when you hear the word social and emotional learning? I think, you know, and I'll go back to when I first heard these words, but for you guys, and maybe you've been around it enough that you have a better understanding, but what comes to mind to you when you hear those words together?
Mindfulness and emotional regulation.
Okay, mindfulness and emotional regulation, okay? What else?
Learning to be human.
Okay, expand a little bit.
So, I'm a teacher. One of the fundamental things I think that schools do very early on is they teach people how to be human, right? That's one of their fundamental roles, especially in elementary school, is to teach kids how to be human beings, how to be caring, how to interact with each other, how to settle differences. Those things oftentimes don't. The situation is different enough and complex enough in the school that it happens there naturally. So learning in large spaces together type of thing about how to interact with families, a lot of times those things don't necessarily happen as much.
And I've never seen that core curriculum on being human, right?
Yeah.
I've never seen that as a teacher. Where's the core curriculum for being human, right? We talk about math, we talk about English, we talk about all those different things, but when we go back to behavior and we start talking about behavior, what's different from teaching them about behaviors, like you're talking about being human, and teaching them math? Do kids still need to learn those skills? Absolutely, right? So that's what we've kind of taken on in our school district, is that fact that we want to teach these kids how to behave, and teaching regulation and things like that. I'll go into that a little bit more. Anything else? Social, emotional learning? Anybody else have any comments about it? Yeah.
Empathy for others
Okay, empathy.
and ability to understand relationships and how to manage them or be in them.
Okay. I think empathy is a big one. Thank you. Yes.
Making friends.
That's hard, isn't it? For some students, that's a difficult thing to do. I'll give you an example, okay? I had a son that went to an elementary school there in Cedar City, at South Elementary, and I think he was in 3rd grade. Now, I may not have that right, but he came home one day and says, Dad, I've got this young man, this kid at my school that all he does is he comes up and he tries to talk, and then he punches me in the stomach and runs away. I went, oh, God, well, you know, have you been able to talk to someone about it? Have you been able to, he goes, well, no, I haven't. And he says, I'll just kind of see what happens. Well, that went on for, probably a couple of weeks. And he finally says, this has got to stop. He said, this is an everyday occurrence where this kid will come up and hang around and he'll try, and then he comes up and punches me in the stomach and runs off. And I thought, wow, this probably needs to be dealt with, you know, if we're 2 weeks into this. What came of this was that this student really didn't understand social cues, didn't really understand how to make friends, and so that was his way of integrating himself into the group of kids and his way of getting attention. Once that barrier was gone, they were able to be friends, they were able to hang out, I guess to say, and they were okay with things. But you talk about being able to be able to have relationships and do it appropriately, right? Those are all things that are important, I think, for all of us to learn. So, yes, thank you very much for your comments. And Leah's already talked about this a little bit, but so we won't spend much time. But social emotional learning provides the structure and process for adults and students to develop fundamental emotional and social competencies and experiences to be able to understand and manage emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and then make responsible decisions. That's really what we're trying to do. We're trying to make sure that they have these competencies to be able to function in society. And then SEL builds and deepens a positive school climate. And I think that's one thing that we'll bring out today too, is that it deepens a school climate, and that's important to remember too. That's basically the same thing, so in a matter of time I'll jump forward. We'll go into, let's talk about research on SEL and student success, okay? We do know that increased academic outcomes are documented. Social emotional skills led to improved attitudes about self, others, and school, and 11% point gain on standardized achievement tests, okay? We know that that's out there and that's able to occur. Reduced risk of failure documented. Social emotional skills led to decrease in conduct problems and emotional distress. Oops. And then let's talk about Iron County School District, and this is where we're going to get into the specifics of what we've done. When I first came into the position 6 years ago, we were encountering a lot of behavior problems in our district, and I think it was not uncommon for the entire state to see this. This was a thing that was occurring, I think, statewide and probably nationwide, is that behavior problems were on the rise, okay? And so, to try and combat this, we brought a group of individuals together to discuss as our psychologists, okay? Other directors in the district office, myself, counselors and individuals, to talk about what we needed to do to try and help these students be able to stay in the classroom or to reduce the behaviors that were occurring. And so at our first meeting, we thought, okay, well, if we've got this many behaviors, you know, we might need to look at maybe a behavior unit or something like that, because they were pretty severe. And so we opted as a group, first of all, to go up and visit a couple of behavior units that we felt like were some of the top in the state. So we took a day and visited a couple of districts up in northern Utah, and awesome. They were some great programs, and they did exactly what they needed to do. The students were being able to function, you know, they still had the consequences and things like that we could see, and we felt like it was a good process that we could follow. So we came back and visited about that. And one of our psychologists made a comment. She said, I've been to a conference and I've watched the movie Paper Tigers and Resilience. Anybody seen those? Okay, if you haven't, you need to. Okay, if you have not seen either one of those, you need to see those, okay? Changed me, and I think changed our entire team, okay? For those of you that have seen it, What was your reaction, or what did you think of either one, if you've seen just either one of them or both of them? What was your reaction, or any comments about those?
Sorry, could you just say the names again?
Paper Tigers and Resilience.
Thank you.
I really like, because it broke down the ACEs study, but then it went the next step and it showed the power of resilience, the power that we can provide in schools for kids that come with high needs and their backgrounds, and the amazing work that's being done.
The power of one, right?
Yeah, the power of one. It was inspiring.
Yeah. Very good, thank you. Any other comments on that?
I liked it because it circles back to that trauma-informed teaching. I think that is really missing in what we're doing, just in the agenda everywhere.
Yeah, and I'm going to spend most of my time talking about trauma, because that's really where, that's what we took in our district, and we build off the trauma. And so we'll talk a little bit more about that. But Paper Tigers was one of those that's it was hard for me to watch because it's kind of a rough movie. If you've seen it, it's real. It's the world we live in. It is what it is. But it was a little rough for me to sit through, because a lot of cussing, a lot of swearing, the F word, things like that we hear in schools, but it doesn't mean you like to hear it, right? So it was kind of rough to watch, but the story behind it is amazing. The story behind it is amazing. So I would encourage you, if you have not seen those, to watch those. Having done that, and having said that, we actually, and they actually talk about the San Francisco Unified School District in resilience. And so we decided we're going to take our team and we were going to go and visit the San Francisco Unified School District and see what they were doing with their HEARTS program. And that's kind of where we based all of ours off of, is the HEARTS program from their district. So as we went there, we visited an elementary, a middle, and a high school just to kind of see every level, so we could kind of see what they were doing and mimic maybe or kind of copy what they were doing in our own district, because they were having so much success with it. And so as we came back, we picked actually 3 pilot schools that we wanted to use, because to roll this out into an entire district we found out to be a Herculean effort. It is not easy. This took a fundamental change, a philosophical change for me especially, understanding behavior and how to treat it as an administrator, and how we go about changing those types of behaviors. And I'll go into that a little bit more. So we picked an elementary school and a middle school and a high school, just like we saw in San Francisco, and we chose to start the process there. Oops. So, sorry, we had 2 pilot schools there, but that's not true. We actually had Parowan High School as well as the one there. So we hired one licensed clinical social worker, because I think coming back from there, we thought this is going to be the silver bullet. This licensed clinical social worker is going to be the key. We're going to see the success that we want to see, because we're going to have that individual in our schools. And as we moved along, and I'll just jump ahead a little bit, then back a little bit, and then back a little bit, but we opted to change our philosophy a little bit on the social worker. Very important, but that's not the key to success with trauma-informed education. The teacher is. The teacher is the key to success with this program, we've realized. And so what we've done is we've implemented quite a bit into our school district, and I'll go through each one of those and talk a little bit about it. As we started these pilot schools, we started with positive behavior interventions and supports, which is PBIS. Key, that's the base, okay? That gives us our baseline, that gives us our networking, what we need in that school to be successful. And so that's the first thing that we had to do, was make sure that was there and that it was cultural. Okay, if you say that you have PBIS and it's not part of your culture, you really don't. Okay, I mean it's something that has to be from the top down, and I don't have time to get into that too much because that would take another hour to talk about that. But just understand that PBIS is probably the fundamental thing that helps with success with social and emotional education. Okay, so we started that, and each one of our pilot schools has an awesome PBIS program that functions very, very well. One of the things that we've never seen before, and we heard about PBIS, but the wellness rooms are things that were a new thing for us that we saw in San Francisco. And so we thought, well, let's try this. Let's just see what this is and how it works, and if it is successful, we can incorporate that. Anybody here ever seen a wellness room or been involved with wellness rooms in their schools? So, yeah, we opted to do that, and we saw amazing things happen with students. The one thing about our wellness rooms is that a teacher can't send a student to a wellness room. Okay, it's self-selected. The student has to choose to go there. It's not a punitive place. Okay, it's a place where a student, even before they go to class, coming to school one day, they can go access the wellness room. Example would be, a student coming to school having watched their parents argue or whatever, they're already heightened, there's already issues. I just got to go for 10 minutes and I've just got to relax, okay? And we have students that actually do that. We have elementary students that understand that process and go to that wellness room before they actually access the classroom. So when we talk about teaching, okay, that just didn't come natural for students to be able to say, well, I think I need to go to the wellness room. That had to be taught. That had to be something that they knew they needed to do. Because at that point, when I have a bad day, or if I'm having a bad day or whatever, I know how to take care of that. I'll go get me a Diet Coke. I'm good to go, right? If I can go off, leave the office for a while, for a few minutes, I grab a Diet Coke, I come back, I'm okay, right? I figured that out through 55 years of living. You get an 8, 9, 10-year-old, they haven't figured that out. They don't know how to regulate. And so you have to teach them. You have to teach them how to regulate, okay? And so we have a process, or what we call zones of regulation, okay? And you may have heard of that too, but that's what we use in our district to help students understand how to regulate themselves. And that's taught in every one of our schools. It's taught from our psychologists down to our behavior aides that are in the schools, and they use zones of regulation so that it's the same language throughout the district. It's not something different in every school. So as we go from elementary to middle to high school, it's the same thing. Okay, so there's no differences, which is important, I think, to remember. So wellness rooms, I think, have been a big success in our school. We had an elementary school that really struggled with, and this is one thing you'll find too, as we went through resilience and talking about the ACEs with our teachers, we found out that not only did we have students that had ACEs, but we had teachers that had ACEs. And we had to figure out ways to deal with that. It brought up a lot of emotion in our teachers, and so that was an unexpected, I think, unexpected for me, I guess, maybe not for others, but I didn't really think of that when we started down this road. And so we've had to learn how to deal with that with our teachers too. And so it was hard for them to be able to change their philosophies, and a lot of them came from that old world school of a pound of flesh. That's what I want when there's a behavior problem. I want that pound of flesh. I want those kids to have to pay for that. Instead of saying, I understand, if you need to go to this room, you don't need to ask me, you can just leave the classroom. That was a big deal for teachers to have to deal with. I don't want a kid just walking out of my classroom, right? That doesn't help me. So they had to change philosophies, okay? They had to change the way they were thinking. And one of our schools, that actually, I'll give you just a little bit of data on them, because it's kind of miraculous, but after 1 year of implementation of our wellness room, they were the highest elementary school, suspending elementary school or putting kids at home because of behaviors and things like that. And they were the highest referral for special education in our district as well. After implementing a wellness room for 1 year and teaching students how to use that and how to access that and how to de-escalate themselves, we went to we were the lowest, I think the data says they were the lowest referring school for special education after that. And they had not at that point, which was in January or February of last year, had not sent a student home for behaviors at that point. So their wellness room had worked for them, okay? And so it's not always as miraculous as that, but in some instances I think it can be for those students and for those teachers. So keep those in mind. Wellness rooms have been successful for us in our district.
Can I ask a quick question?
Yes, please do.
How was instruction provided about how to use the wellness rooms?
and
So-
deliver that?
In our PBIS process, that's a room that every student goes through and says, this is what this is for. This is what you need to use this for. It's not just something to come down and does it get abused at times? Yes, but what we've done is we've been able to track the data. We know when it's being abused, and then an administrator would have to come in and get involved with that. If a student's just doing it because they're going to meet a friend down there at the same, believe me, it happens, right? They'll coordinate that. They're smart enough to get that. But when you look at the data, you can see if it's every day at 10:30, you either know there's a student they're meeting there, or they want to get out of something. So there may be a math issue, there may be a reading issue. So what it does is it pinpoints really what the issues might be, why they're acting out, why they're causing problems in classes. So you can decide that. It gives you that data to do that. But they're all instructed on how to use it, how to access it.
Is that by the teacher, the school administrator, or?
That explains it. We have people that are actually in the room, that as those students come by, the social worker would actually work out of that room, as well as behavior aides, and they would instruct on how that room was to be used.
And is that the way it's modeled at every school or just in your pilot?
So all of the schools that have rooms right now, yes. Not all of our schools have wellness rooms at this point. We're still trying to find funding to be able to do that. Plus, in schools it's tough. There's not a lot of room to do that. But where they are there, that is the way the model works, is through the PBIS instruction.
What's the sort of setting of the wellness room like? What's the environment there? Like, how is it set up?
So whatever room we can find, whatever space we can find, but it's a non-threatening, non-intrusive room. I mean, it's sometimes it's as big as this room. Other times it can be a quarter this size. There are manipulatives there that they come in and they can use. What happens is when they first come in, there's a timer that they turn over, and it gives them 15 minutes. They're not bothered unless they want to talk to someone. If they want to talk to someone, there's always someone there for them to be able to engage with. If we find that a student is coming down multiple times, just like she had mentioned, the person there will actually ask them and say, hey, is there something I can do to help you? And just before they go back to class, we'll say, are you ready to go back? Your timer's up. It's time for you to go. Is there something I can help you with? Are you okay? And then they typically will just go back to class. But it's like I said, a lot of times the lights are dim. It's just a non-threatening environment. Yep.
So was it your school psychologist that helped build the items in the room, or was it your occupational therapist?
School psychologists. It was more of a team effort. Our occupational therapists haven't really been involved with that. Our school psychologists have been mostly.
Yeah, I'm sorry, I'm coming from a clinical classroom, residential day treatment, and that's who we use to build our, we call them chill rooms.
Yeah.
And they, I'm assuming, work very similarly.
Yeah.
But anyway.
I mean, it's a good idea to involve them. That was not something that we had done at this point, but yeah. Great idea.
Yeah. So what type of data are you tracking? Are you tracking every time a student asks to go there, arrives in the wellness room, or just when they're sent there by somebody else?
No, anytime a student comes to the wellness room, the wellness room person tracks that. We use Educator Handbook as our data depository, I guess, and it does a great job of tracking all that because you can make it fit to what you need. So that's what we've used. We've purchased that for every school in our district, and every behavior that occurs in the classroom, whether it be minor or major, is documented, and all the data is kept in the Educator Handbook. So, any other questions about wellness rooms? All of our schools were trained. We actually sent our psychologists to a training, week-long training for trauma-informed care. And every one of our schools has received training on trauma-informed care as well. So all of our teachers have been trained, which was another effort that was huge. It was something that was not easy to do, but we were able to do it. PBIS was initiated, which we've talked about already. That's part of our framework. Educator Handbook. This is another part that we've changed. We've hired 2 behavior aides for every school, okay? Our goal in this is to try and push in all of our behavior when possible. Instead of pulling kids out of class, which was occurring in our district years ago, we had what we called a skills room. And over the last 20 years, that skills room had turned into whatever the principal wanted it to be. And so we've kind of reworked that. It's now, we don't have a skills room, but what we have is in-school supports, and we have a wellness room that have replaced those. So kind of interesting, what we've done in our district is that we've, like I said, we've added 2 behavior aids that the school psychologists train in all the behaviors that they need to, to try and help these kids be successful. And we'll push into the classroom for the behaviors. We try not to pull out. There are times that we have to. If that were to occur, the principal would make the decision on whether in-school support was the right place for them to be. But even if they go into in-school support, we have cameras in our classroom, and the teacher gets to be filmed, which they love, obviously. And that goes back to the student in school support. We go through Zoom or whatever, and they have to watch that class being taught while they're in school support as well. So they still receive that instruction while they're there. It's not just that they're out doing whatever they want. They have to watch and be a part of that instruction from a Tier 1 teacher, even in school support, okay? So that's a work in progress, okay? We do have all the behavior coaches hired for each one of our schools, and all of them do use the cameras to be able to help those students not miss out on instruction, okay? Once again, this has been a difficult thing, I think, in the sense that for 20 years, the teachers were able to say, Jimmy, you're acting out, you need to leave the classroom, and so you need to go for whatever amount of time that may be. And no longer is that the case. Now we call for behavior aid to come in and either support in the classroom or pull the student just for a few minutes out in the hallway to talk and try and de-escalate, and then get them right back into the classroom. And we've seen some success with this. Once again, it's different, and it's been hard for the teachers to be able to take that back on. But that's been, like I said, it's been the training that's helped with that. And each one of our teachers have been trained in interventions, in behavior interventions as well. So that's a work in progress. All right.
Can I ask real quick about your training on trauma-informed care? Was that just a typical professional development activity, like in PLCs or?
No, it was actually, we took a full day. We paid for substitutes and took a full day in each one of our schools, and we taught trauma-informed for a half a day, and we did restorative practices for the second half of the day for all of our teachers. That was done last year. Now, for them to become a trauma-informed school certified, it takes a lot more than that, but what we're finding is that that's a 5-year process, and so it's going to take some time to get all of our schools to that level. But that's our goal.
And you're working towards that?
That's our goal. Yeah, it's hard. I mean, when you start talking about resources in a district with 10,000 students, that's a hard deal. We have 600 teachers, and to be able to train every one of them like that is not easy. And so that's been a challenge for us to be able to do that. So. We also started, I had one of the psychologists actually in our district is my brother, and he came to me one day and said, hey, we want to go to a training on yoga. And I said, no, we're not doing yoga. Okay, that's not something that I've never ever heard of in schools. I think that, no way. He goes, come on, Kevin, there's actual data out there that shows that it's successful and it works. And I finally said, okay, so I sent my 2 psychologists to trainings on yoga. Actually it's mindfulness is what it is. But I'll tell you what, out of any of the programs, I think, well, not any of them, because I think they've all been fabulous, but this one, I've been able to go out and actually watch kids be involved in the classroom with yoga, and I'll tell you what, it's opened up their minds to being able to regulate their anxiety, to be able to regulate before tests, breathing and stretching and understanding their thoughts and what goes on. It's invaluable to these kids. That's not something that usually a parent will sit down and say, okay, let's breathe. I probably should have used that a few times with my own kids so it would get the anxiety down a little bit. But you know what? That's a skill that kids typically don't come to you with. And I sat and watched a 2nd grade class go through that process, and it was amazing. Some of the questions that they would ask, I thought, wow, this is really working. And so I'm a real proponent of mindfulness, whether it comes in yoga or whatever. Yeah, I think it's been helpful, yes.
So, out of curiosity, how has your superintendent, your board, those major players, have they supported this process? Because obviously this is a lot of money and resources going into it. So, have they had to wrap their heads around it to get to this point? Because how extensive it is, or like what process did you go through on getting their buy-in?
Superintendent's been fabulous. I mean, I think we think similarly. because it's the right thing for kids. It really is. It's the right thing to do. And does it take a philosophical change? Absolutely, it does. I mean, there are a lot of individuals out there that came through the education system like I came through, and really what we were doing as administrators, we were dealing with the symptoms. We weren't dealing with the issues. And so it's changed. Instead of dealing with symptoms, let's start dealing with the core issues. And you'll see this slide, but I'm going to say it now. Let's be the fence at the top of the hill instead of the ambulance at the bottom of the hill. That's what we were. We were the ambulance. After they'd had the behavior and the issues that they'd had, we raced them off and suspended them or sent them whatever they needed to do, and then said, okay, 10 days, come back, let's have the same behavior. I mean, that was what was happening. So I think once people realized, the work and what it was doing for the students and how beneficial it could be, I think it was fairly simple to bring
How long did
people
it
on board.
take to get them on board with starting this significant process?
Well, I got the superintendent on board before we even went to San Francisco. So from the very beginning, we told her what our hope was and what we wanted to do, and she gave us the blessing to go ahead and do that. And the board has always supported what we've done. The superintendent has gone and asked for whatever funding. Example would be we just hired 3 social workers within the district, which isn't cheap. You start talking about, benefits and salaries, you're looking at, close to $300,000. That's a significant investment. And if the money was there, they believed in it enough that they were able to come up with the money to do it. So they've been very, very supportive as far as that's concerned. And being able to get the money from the legislature too has been just a boon for us, if we can find people to put in the position. So it's been great. So we also now, and one of our schools, like I said, had the yoga and mindfulness, and like I said, I went to the classroom and watched it a few times. It's been amazing to see that. They also got to the point where every one of their classes was going to a yoga class twice a week, which is amazing. Okay, they were able to work that into their schedule, and they had hired a part-time yoga instructor that allowed them to do that. And they worked that. It was important enough to them. They worked that into their schedule. And now we have a designated person in every one of our schools that is teaching yoga, whether it be through PE or whether it be through just like the elementary school was doing, having a time set aside for that to happen. But every one of our schools actually has yoga or mindfulness incorporated into what they do during the day. So we've done that. And kind of the cherry on the top of everything is the restorative practices. And we have a person that's kind of become an expert in our district on that, which has been fabulous because she does a great job with it. But this really makes sense to me. This is how we should deal with discipline, is through restorative practices. I mean, if we can restore the relationships that have been hurt through restorative practices and doing it this way, that's the way it should happen every time. And we've seen a lot of success in using circles and things like that with not only staff and students, throughout our whole district. It's been successful in everything we've tried. And so this is something that we're incorporating as well. In all of our schools, and all of our schools have been trained on restorative practices. And we've seen some great benefits. It's been interesting. One of my jobs is the human rights officer in our district, and so I do investigations. And so when I do that, I make reports, and I send those reports to the superintendent, and then she decides what needs to happen at that point. Well, we've actually used restorative circles and restorative practices on some of those instances that have occurred, and it's worked out quite well. And so when Leah starts talking about that being an initiative, I think it's important because it just makes sense. And if you take some time to study it, because I don't have time to go into it too much, but take some time to study it, because it really, as you do, you'll say this is the way it should happen. This makes sense. This helps kids. I'm probably over my time.
No, you still got
I
8
think
minutes. You started late.
Yeah, you can take a little bit more.
Okay, because I've got like 85 more slides, not really. So this was, like I said, the aha moment. It just makes sense to me that we need to be the people that try and catch these kids at the top, and not trying to take care of them after all these things have occurred. And so we've kind of used this as our aha moment, and anyway, hopefully it resonates with you too, because it just makes sense, and that's the way kids should be treated and dealt with. So, and like I said, I'm not going to be able to go through all this. Let's just jump to questions real quick, because I wanted to talk about trauma, but I don't have time to get into it and feel like I want to. So, does anybody have any questions about what we're doing?
Under restorative practices, is there a difference in how they're being handled in the special education setting compared to the regular education setting, or is it the same process?
It's the same process right now. I mean, as we go through that, and if we see that there needs to be something different, then we would do something different. But right now, where we're so new at it, there's not been a change. It's the same. It would be the same.
Okay, so there's not like manifestation disability and things are not going into that.
Well, that all happens, yes. But the restorative practice part of that, once the superintendent's made the determination or whatever, and we go through that process, that's all taken into account, yes.
Okay.
So it would not take that in. It's just that would be part of it.
What are you doing to balance the different perspectives in intervention between a trauma-informed care approach and a behavior, like an ABA approach, especially when it comes to like planning functional behavior assessment? They kind of look at things in a different approach. What have you guys been doing?
Well, that's a tough thing to incorporate because it is so different. But once again, everything's individualized anyway. And I think that's the beauty of the whole program, is that you make those relationships with those kids. And I hadn't been able to get to that point yet, but really the key to this too is the relationships that you have as a teacher or as an administrator with each one of these kids. It's important to have that respectful relationship with them. Then it becomes more individual anyway, right? We have not incorporated in, we don't have an ABA therapist in our district. We don't have any BCBAs. We contracted with Kids on the Move for a period of time. We now contract with Utah Behavioral for supports and things like that with ABAs and BCBAs. So that's all part of the process. It's all part of, something that we would use to help with those students. But we're still trying to mesh that together. That's a tough thing to mesh at times, but that's something that we're looking at doing and trying to do. Yes.
Earlier in the presentation, you said that you visited some behavior units up in Northern Utah. Which schools?
We went to Provo School District and Nebo School District. I couldn't tell you the schools exactly. We just went to their districts and looked at their behavior units. Yes.
Do you guys use any sort of like universal screener for kids who may have problems, kind of like we use Acadians for reading, right? Like, do you guys...
You're talking about for social and emotional problems?
Yes. Or do you do that once you start seeing a pattern of them coming to the wellness room a lot?
We have really tried to figure out how to use the ACEs study without breaking any types of issues with, confidentiality and stuff like that. I really think that's probably one of the better screeners, obviously, that there is the ACEs study. And for kids at a young age, that would be a hard thing for them to answer, but I think they could be helped through that. But we're still trying to work through that. I think it's really what we're looking at is the numbers, the behaviors that we're seeing, and that's how we find the students.
Right.
So how much kind of explanation do you find yourself offering to parents when you identify what these student patterns? Because I imagine your parents, just like all of us in the room, didn't grow up with these opportunities as kids when we went through school. So how does that education process look?
Well, we do it in back to school night. That's a big part of what we do in those schools, and informing them on what this is and why it's there. To give you an example, we partner with Southwest Center, which is a mental health facility in our area in Iron County, and we have them come to our schools. They come to our schools one day a week. So this is having social workers in there. It's just an addition to that, which is great. And we partner very, very well with them. What we were finding, though, and I think why it's so important that schools take this on, and I'm a believer in it, I don't think that should be an outside agency. I think schools have that relationship with those kids that they can actually I'm not going to say do a better job because that's not fair. They can actually, what's the word I'm looking for? Having that relationship already there makes a difference in being able to have that mental health help, I guess. So there was an instance in one of our schools. This was in Parowan. There was a student that needed mental health help, and they weren't being taken to the Southwest Center. the parents would just miss the time that the therapist was at the school. So it was on a Monday, and every Monday that student was absent, every Monday. And so us being able to put a therapist in there 5 days a week, that excuse was gone now. They were able to access that student, and they were able to help that student. And honestly, that student's doing very, very well. I'm not saying that's the only reason, but there were other things that occurred in his life that were able to help him move forward. But that's why I think it's so important that schools have that, because we have access to those kids a whole lot more than anybody else has access to, and those relationships are already there. So I like the idea of mental health work going on in schools. I think it's appropriate. I really do.
Christina, something that, sorry, it's digressing off yours specifically, but something that my daughter's school does, they do like a social emotional presentation once a month at their school. And they've started sending that slide out to the parent community. So it's an empowerment to the parents on understanding, one, what our kids are learning, but also teaching the parents, because like you said, it's not stuff that we were raised accessing when we were younger. So it's another way to empower the parents so that when these conversations come up by the administration, theoretically they're not as on the defense and such, it's a more healthy conversation.
Okay.
What are your sort of next steps and plans going forward to continue rolling this out, as far as then what major obstacles have you seen?
I think the biggest obstacle we've seen is probably just the integrity of the program as it reaches out to 16 schools instead of 3. That's a hard thing to be able to take care of. We're doing it, but I think there needs to be more oversight, I think, to make sure that the program is still functioning the way it needs to be functioning. I'm a major proponent of schools being able to do what fits their school. I think that's important, but I still think the structure of what we're doing, the PBIS part of it, and the wellness rooms and things like that are important enough that they need to be kept in place. So I think that's been one of the major obstacles. The other one would be the reaction that we've had from teachers and the ACEs and things like that. There's been some pushback. Some of our teachers, and I'm sorry for myself, 2 males, I got through it. Why can't you get through it? I didn't have the help you had. Why can't you? You can get through this too. And so we have to push through that. That's been a hard thing for us to do. We've had to back up, and we've had to look at it a different way and try and go a different route to try and help those teachers understand. And we're making progress, but that was an obstacle I just thought, people would understand the way I thought. This is just the way it should be. This makes sense to me. This is right. Well, I thought wrong. But we are making progress, and I think that's another major obstacle. I think, our process goes from PBIS to restorative practices, and everything else falls in between there. Our goal is to have those running with fidelity in all of our schools. So we're not adding anything else at this point. We feel like we have what we need for the social emotional part. We're looking for a curriculum that we can use. So that is a process that we're going to put together. But we kind of know where we're headed. It's now getting it into every school and making sure it's all run with fidelity. Yeah.
Since you're introducing this at a wide range of ages, right, from younger kids all the way through high school, I understand, right? Are you talking about how these are generalizable or life skills? As you've talked about, they're new, maybe for parents or teachers, but how kids can take those same kinds of things, that asking or going to the wellness room and understanding when those feelings are coming and they need that break, how that translates into adult life, be it post-secondary ed or school, work after.
Yeah, that's always something we can do better, but that's something that we're talking about. Social workers especially, they're the ones that are taking that time to talk through those things, and yes, they are using that. These are lifelong skills we want. We don't want just situational skills and understanding. We want this to be a lifelong thing. But we can do better at that, absolutely.
It's just a concern, because you can imagine you develop those skills and then you have no place to implement them, but you know you need to.
Yeah.
What do you do then, right? It's sort of caught in a circle.
I agree with you, so thank you. That's something we need to do better.
Just to piggyback on that, we just had Dr. Ray Jocelyn come out from USEAP. We contracted with him to do some training support in our schools. And he taught there's the state, I'm assuming, has been using the good behavior game, which is just a way to reinforce behavior. And they've done some longitudinal studies on that. So I'm assuming if there's some sort of program in place, but their longitudinal studies over time has shown that the students that have been participating in something like that have reduced rates in alcohol use, drug use, incarceration, all that kind of stuff. So there are some studies out there, and I'm assuming he indicated that it has to do with being able to regulate, being able to be aware of your behavior, all that kind of stuff. So there are some research-based.
Well, and our data,
You're all
laughing.
and our data shows that too. Educator handbook, you know.
Great.
We can show that the amount of referrals to the office are declining. So, but yeah, we're hopefully teaching that as a lifelong skill. Yes. Yeah.
And I don't know if you're tracking this kind of data, but I'm curious to know if you feel like it's impacted suicidal ideation or suicide attempts in your school.
If I were to bring my social workers up here with me, they would say absolutely. Now, that's hard data to know because, you know, the only data we have basically are those that actually try, right? I mean, we do have data on those that may be thinking about it, but if you were to talk to all my social workers, they would say, yes, we have stopped suicides. We have had people in our offices with a time, a place, and a reason, and we've been able to get them the help they needed. So they would say yes, and I would have to agree with that. It hasn't completely stopped, and no, we had one in our district just this last year. And so no, it hasn't completely stopped them, but I do know that they have had students in their office that have been to that point and they've been able to help them. We also use, I don't know if you guys have heard of tappers, bilateral tappers. We use those quite a bit in our district. That's something they found that helps reduce anxiety, and it's been a real benefit. Our high schools really like using those because it's easy for those kids to take. If they're going to be taking a test and they're anxious about it, they can use those tappers. They can put them in their socks. They can hold them in their hands, and it's just a matter of something to do with the brain. But they said that it's been very, very helpful for kids with anxiety and things like that. Yeah.
What have you done to make sure that this program, as a school-wide PBIS, is also included within classrooms that have children with more significant disabilities?
Well, everything we do in the schools is through our positive behavior intervention system. All of our students are a part of that. Everybody is trained, everybody has that same expectation, and they're all given the same opportunity. So that part of it is, as far as integrating it across to wellness rooms and things like that, all those students are able to do that. I don't know how much they are accessing it. Yeah, that's I wouldn't know that at this point, but I do know the options are there for them to access it if they needed to.
Yeah, along that, I like that question. I'm curious. So with students with disabilities, especially more severely impacted, gaining access to their gen ed classroom traditionally is more challenging, even though the law says it, yada yada. Have you seen, perchance, any improvement on the inclusion work to have these children access their gen ed placement as their first and more successful placement?
I would say yes, in the sense that I think the training the teachers have had with behaviors and things, just understanding maybe how to deal with them and having some interventions in place has allowed them to feel more comfortable, because sometimes that's what that keeps them out, is that teacher does not feel comfortable. So I would say yes, we've seen an increase in that and more of an ability to be able to do that. I don't have any hard numbers for you, I'm sorry, but I do, having gone around to all those IEPs that I go sit through, I do see a more inclusive attitude from teachers having that training and that understanding. So, yes.
Do you have a particular curriculum that you follow to do this, or are you writing one? And first of all, I want to clap my hands to you guys. You guys are fantastic. I've been trying to implement something like this in my children's school and making it up on my own. I didn't even know something like this existed, but I knew there was a huge need for this, and so I've been working with them. But is there something already in place? Did you get something from the school in San Francisco that you went to go visit? Like, how are you coming up with your step-by-step process? I mean, I've taken ridiculous notes from you, but do you have something that's available?
It's nothing that we have written down. I guess maybe we should sit down and write it down. It's not. We've invited anybody to come in and see our schools and watch them and how they operate. I mean, I'd invite you to come down, an administrator or whomever, just to come down and go through a day with what we do and how it works and how it looks. As far as just a written curriculum, no, I can't give you. I don't know. No, there's nothing like that. We've actually literally built this as we've gone. I mean, and we're still changing and we're still trying to add on and do things that we feel like would work. So, but we're happy to share it with anybody that would love to want to come down and see it.
Perfect, thank you.
One of the things that Dave talked about at the Governor's Education Summit, one of the experts was up there, he sort of, the idea that there would be a massive curriculum, he kind of balked at it a little bit. He's like, look, it's so based on the needs of that local community that it almost has to be done at that local level. So it's not like there's going to be this major overarching thing. It's more like you have to just make it intentional and look at it, work through it. Kind of like that. Like you're just going to, we'll try this. Okay, this isn't. You know. So
maybe there's something that's kind of bullet pointed. Start here, 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 and then do your own branches.
I don't know that 5 years ago you could have found much out there on social and emotional learning at all.
Oh, yeah.
Now if you type it in, there's pages. I mean, I think people understand and see the need, so they are starting to put that together. But like I said, we've just kind of done it. We've kind of picked our path. And like I said, it started at PBIS, and we're putting restorative practice. We feel like that everything can fit nicely within those bookends. And that doesn't mean we're not going to look elsewhere or something will come, but I think that's what our goal is right now, is to be able to have those two in place and everything else in between be able to work together.
Have you guys measured the impact upon like teacher retention, teacher morale as far as unveiling these programs?
No, not at this point we haven't. I personally know there's national studies that show that it's working. It's helping teachers stay in schools and being teachers. So for our district in general, no, we have not. I think that's something we would do once we get that rolled out to an entire district, and we can take that data throughout all of our schools. But that's something we do want to do. So that would be a process we'll go through eventually.
Is there any problem, like when these kids leave the classroom to go access your wellness room? Is it a problem with what they're missing in class? If they were missing a test or anything, the teacher just helps them.
Yeah, the teacher would help them catch up. I mean, once again, this has been one of the hardest things too that we've had to do, is have a teacher just allow a kid to get up and walk out, because we don't want to draw any attention to them. We don't want them to have to ask permission. This is just, I need to go, and I need to go. And so that's been hard for them. But it's only 15 minutes, and then they're back. Just another example, I'll go through this real quickly, but at one of our schools, one of our pilot schools, we had students that would just flop down in the middle of the room during a math lesson or an English lesson. And because they're not a danger to themselves or others, we can't do anything with them. So we have to wait them out, right? We have to just go through that process. And it was frustrating because sometimes it was an hour, sometimes it was an hour and a half that we were dealing with this in the classroom. And once we implemented the wellness room, and I'm not saying this is the cure-all, but that has not happened since. Once we've taught those kids how to, or what they can do to regulate, they will access that room and regulate it. And I don't know, I'm sure there's more to it than just that. That seems so simplistic, but I do know it's helped. And having them have that understanding of what that regulation looks like and what they need to do. Even if a kid accesses it 5 minutes before school starts, there's a reason why they're accessing that room. And that's great evidence to show that it actually is working, and they just need time.
Well, I think that's got to be empowering to them to know there's something I can do when I'm feeling this way to help change that.
Yeah, I just need time, right? Sometimes I just need time away. An hour commute sometimes isn't a bad way to go at the end of a hard day. Yes?
So, and maybe you've talked about this, are you teaching emotion regulation skills in classrooms? emotions, or you're just teaching them how to identify their emotions?
The mindfulness is part of that. That's kind of teaching those skills through that a little bit.
Okay.
We teach those skills when they access the room. That's exactly what's taught by the wellness room, the people in the wellness room, that that's a necessary thing that they like.
So there's a little bit of instruction that happens in the wellness room?
Yeah, if a student, they're going to engage them. They're not just going to let them hang there. I mean, it may be at the end if they haven't come and talked to them, they'll engage them and say, is there something I can help you with? There may be some teaching that goes on there. But the psychologists, we've tried, like I said, we've tried to get enough psychologists to be able to go into those schools and help teach those types of skills to those students. And they are taught. It may not be initially, but it's taught after, once we see that they're accessing that room. Yes, there is zones of regulation is one of those things too that helps them understand where I'm at and why I'm there and what I need to do to calm down.
So it's more individual basis than like
we do
tier
groups.
one
We do
or
groups.
teaching the
So
whole school.
yeah, and I'm sorry, I missed that
It's
part.
okay. I just wondered if that was something that was part of
But
it.
our social workers and counselors now, we have groups now that we've never had before. So grief groups, social groups, zones of regulation that we pick those students that need to be in there, and that's where they're taught those skills from a social worker. Now that's not every student in the school. That's just those that we feel need that.
Like a tier 2 or a tier 3?
It'd be a tier 2. Tier 3 would be more of our therapeutic sessions with our social workers that were taking place. But those groups, in one of our middle schools, we had over 500 kids involved in a group, one or another, that we just felt like needed to have those skills. And so that's a significant amount of students.
Yeah.
So thank you for bringing that up, because either I didn't get to it or I skipped right over
It's
it. but
okay.
thank you.
Have you identified then the RTI process for sort of that social emotional learning component?
Yeah.
Behavior regulation?
Obviously, tier 1, is the classroom, the behaviors that go on in there. The behavior coaches work on that. Tier 2 would be the groups, and tier 3 would be our therapy. We have what we call a tier 4, which would be Southwest Center and their therapy as well. That would be our tier 4 students. But yes, we have identified that.
Okay, cool.
Thank you so much.
Sorry.
Can we possibly get your presentation?
Sure. Yeah. I can email it. Want me just to send it to Leah?
Yeah,
that'd be great.
Okay.
Put it all together.
Okay. Thank
Thank you so much.
There's this one coming.
Okay, turn time now to,
Yep.
from Duap School District, and if you could go till about 11:30.
Oh, I can get us back on schedule. Don't worry.
It
takes a really good meeting to be no meeting at all. Let me see what that is. All right, so no, we're not working again. It doesn't like me all of a sudden. So I appreciate the opportunity to be here. I will say that I feel a little bit out of place in this group with this audience. My background is as a school administrator, which has been the last 18 years of my career. I've been in school administration, and the fact that I'm in education is, if you went back and actually talked to my teachers that had me in school, they would think would be a major disservice to the future of all generations that are coming. We've referred to the ACEs score, and I heard Lieutenant Governor Cox. He was the first one I've actually heard do this the other day in the governor's education. Somebody stands up and he says, "I'm a 5 ACER." I thought, that's one way to introduce yourself. Well, I'm an 8 ACER. And my upbringing and my experiences in life and how education was delivered to me and how I engaged education through school was definitely non-traditional. It was traditional in how I came to it and how it was delivered to me, but I was definitely not your traditional student in the sense that I was not set up for success. But there were a few people in my educational experience that had such profound impacts on me that when it was time to decide where do I want to go and what do I want to be, they heavily influenced that decision, and that led me into the teaching and coaching aspect because they were coaches. One thing that I had working for me was I happened to be really, really, really fast. And I happened to be really, really, really good at a couple sports. And in small town Utah, that makes you valuable. But beyond that, had I not had those couple of things working for me, I probably really, really, really wouldn't have mattered to a lot of people in school. And my parents would have been okay with that. So when I came into education, it was a personal thing for me because I saw very quickly what the system of education can do to kids that don't fit the mold that we want all kids to fit. And I'm not going to speak specifically to special education or students with disabilities or students that don't have disabilities, because I'm going to speak from the assumption that all kids have disabilities. Some just don't qualify them for special education services, but all of them have disabilities, and all of them have needs. So when I came into education, my administrator came to me, I think it was, would have been my 4th year teaching, and he said, hey, I need you to do your administrative endorsement while you're doing your master's because I want to hire you as an assistant principal. So I was in the classroom for 4 years is all. And the next year I went into administration. And here I was, 27 years old, brand new administrator, and the first day of school rolled around and I got a phone call from the principal of our alternative school. And the principal said, hey, I haven't seen your names yet. And I said, my names for what? And he said, the names of the kids you need to send to the alternative school. I said, why do I need to send kids? It's the first day of school. What am I? He says, no, you don't understand. You have, I can't remember, 15 slots or X number of slots. You need to use those. Go ahead and send those kids that you don't want to deal with this year. I said, I don't even know who those kids are. I just barely got here. He's like, well, no, you need to do that. And I was like, well, I can't. I just don't feel right about it. And he's like, well, that's your loss. I'm going to give those spots to somebody else. Well, later that day, I got a phone call from the assistant superintendent. And he said, what are you doing? He says, I know you're new and I know you've got the best intentions, but let me explain to you how this works. And after he got done explaining to me how it's supposed to work, that, we make things good for our teachers by removing these kids that might be a little rough. And we'll give them what they need over in the alternative school. And honestly, best intentions, I'm not trying to throw these two under the bus at all, but this is 20 years ago, and they really did have the best intentions. And ultimately, he says, well, Roy, it's your decision. But you kind of have to live with this. So when your teachers start getting upset, you need to own that decision. If you're going to keep these kids in your building, you need to be the one that supports those teachers when they're struggling with these kids. And I'm like, I'm good with that. And it dawned on me at that moment how quickly we throw kids away, or we make decisions for kids that put them into a trajectory or a path that we know is not going to help them succeed. And I knew that because guess what? I had lived it my whole life. And I'd been the kid, i.e. minus the fact that I was really, really fast, and I happened to be really, really good at a couple sports in a small town in Utah, that would have been thrown away. And all my brothers, I have 10 brothers and sisters, and I'm the youngest. It's safe for me to say my brothers are hell on wheels. I could see why they got decided to go somewhere else. They didn't graduate high school, all of them but one. And their lives have reflected some of those decisions that I would argue were made by other people who made assumptions about what they were, and then those led ultimately to decisions about who they were going to be. And so I want you to understand that about me, because that's what drives me as an administrator. That's what drives me as an educator. is that personal experience. Is that knowing where kids are coming from and the idea that there is something for them that is of value to society. And I know very well that if we make certain decisions, we will actually do a detriment to society, and it will cost us a lot of money in a lot of different ways. When we could have easily just spent a little bit of time doing a little bit of hard work. And I want to emphasize that. This is hard work. Kevin, this is hard work. It is not easy. Don't any of you believe that what we're talking about is easy. It is hard, but it has tremendous reward. So our journey at USEAP School District and how I'm going to present what we're doing is through the lens of our attempts to create a culture and a system that requires less programs, less backside reaction to needs. Anticipating up front and trying to create a system that accounts for the individual needs of every student first, before we ever start. That's the ideal. That's the utopian goal. Are we there? No. And I want to emphasize that and stress that. We are not there. This is about a journey. This is about a process. So one of the big things that you will hear said over and over again in our district is that we are striving to meet every student's individual needs and remove any barriers that we may be creating, we being the school system, that would not allow them to be successful, whether that's policies, whether that's practice, whether that's a structure, any of those things that we can adjust or change for a student to help them individually be more successful. We want to give it a look. We want to try to do that. So that's the first thing that I think we focused on. And again, this I've presented about 35 times in the last 3 months, and so I just kept the same slide deck. Some things will be kind of universal, and I'll skip over others. So this is our strategic vision. And I only put this up here for one important purpose. What is at the center of our strategic vision? Portrait of a graduate. And for us, the portrait of a graduate is not one portrait. The portrait of a graduate is specific to whatever student we are talking to. Now, there are some general guidelines and parameters of what a portrait of a graduate is that were developed, and I'll show you those in just a second. We'll talk about those. But overall, in our district, what is your goals? What are your aspirations? What is your success? I know we have a lot of people in here that are very, very versed in special education. I'm learning more about I am the special education director in our district. I have never been a special ed teacher. Again, I came to it from an administrative side, and they said, oh, you're the assistant principal, or assistant superintendent, and by the way, you're our SPED director. I was like, thanks, that's awesome. Lord help us. Luckily, I have really, really good SPED teachers and that help me, and great support from USBE that answer a lot of questions all the time. But again, what I do know and what I've always understood is that special ed students with disabilities, we know that their rights are protected through an individualized education plan. The question I can never figure out is, why isn't every kid? Why isn't every student afforded that right to have an individualized education plan? I know they all have different aspirations. I know they all have different strengths. I know they all have different weaknesses. So why are they any different than a student with disabilities? And in my mind, they're not. Their needs are just potentially a little different, and not always different, but sometimes they may just be just below the line, where another student may be just above the line, as we speak to eligibility under special education. When they brought me to the district office, first of all, as the principal, they brought me up to be the principal at high school 7 years ago from Southern Utah, where the majority of my career had been. And USEAP the superintendent, Dr. Robbins, had just been hired. He and I had known each other for quite a while. We knew we had very similar philosophies about education. We had actually quite similar backgrounds and upbringings. And when he was brought to the district office as a superintendent, he came and recruited me heavily to be the principal at the high school to replace him. And as we talked through, I told him, well, I've got some pretty extreme ideas, you know that. And I've got some pretty big goals for a school. I said, can you support me? And he's like, absolutely, that's why I'm calling you. I said, can the school board support me? He says, that's my job to worry about. So don't worry about that. They will support you. So I said, okay, and off I came. So right off the bat, one of the first things that we started talking about at the high school, which we're a small district. So 3 elementary schools, a junior high and a high school in USEAP School District. We're not big, 2,700 kids. So what the high school, as in most small towns in rural Utah, the high school is kind of like the flagship. It's kind of where everything happens in the community. It revolves around the high school. And that's a great thing. That's a wonderful thing about small town Utah or small town America. But one of the things that we talked about is what we're doing getting us where we want to be. We've got these great ideas. You guys are telling me you want to do these great things, but let's stop and look at what our structure is. Let's stop and look at what some of the policies we have in place. Let's stop and look at what we're doing in our individual classrooms and decide is what we're doing really getting us closer to where we want to be. Simple things we started with, like what does your grade mean in your classroom? And teachers trying to answer that question was, that's a loaded question. It seems like a simple question, but for everybody that's a teacher in here, or even as parents, what does a grade mean? There's a whole discourse that you can have on that. But really trying to narrow down what we considered our grades to mean, and then what we were doing to students to determine a grade, because we use grades as the currency of learning, do we not? It is the only currency of learning that we have in education. And we use it as a stick, we use it as a carrot, and students with disabilities, and I would add all students with any type of learning struggles, which social emotional skills, dispositions, if you don't have those in spades, playing the game of school can be very, very difficult. It can be hard. And so what happens when a student starts getting D's and F's? What does that student start to believe about themselves as a learner?
They suck at this. They're bad at this. This isn't for me.
I'm stupid. I'm stupid.
Either that or that the system is stupid.
Yeah.
Once they hit junior high, that's what they start thinking.
As recent to college,
yeah.
I hear either I'm stupid or this system is stupid,
right.
Or both.
Or both. That's right, because it doesn't fit me. And I can see the idiocracy in what is happening here. They're saying this, they're telling me that they expect this, but then they do this, and they're this far apart. The hypocrisy of the system sometimes is what drives kids to act out in school, what drives kids to quit school, what drives kids to shut down. And we could say, well, wait, no, they just need to learn, good systems. You're not going to have a job that always does exactly what you want it to do, how you want it to do it. That's true. But I'm not paying a 4th grader a salary to come to school. If I was, then maybe I would expect them to put up with some of our stupidity. But I'm not. Kindergartners don't come to school. By the way, one of my favorite places to go, kindergarten classrooms. How many kindergartners believe that they are not smart? The answer is this. Where's my early childhood people or anybody who's ever... How many kindergartners believe they do not have potential? How many kindergartners do not believe that they have a future? I don't care. Insert any kindergartner. With disability, without disability, I don't care. Any kindergartner. 0. If I ask that same question about a 2nd grader, what happens? It's not 0 anymore. Because by 2nd grade, we have taught kids that they are not smart. We have taught kids that they can't do it. Not intentionally,
not intentionally. That is no teacher's intention. That's no school's intention. But we have to be honest and admit that our system and some of our practices within the system lead to those type of outcomes for students, okay? Again, this is focusing in on our personalization. That's just some of the things that we ask our teachers to consider when they're thinking about, this is called the Core 4 in our district. This is basically some of the areas that we ask them to consider when they're thinking about, am I personalizing learning in my classroom for all students? You better be able to answer these 4 questions. Not really pertinent to this conversation today greatly, but I think this is. Again, for those of us, I've heard the term PLCs today. What are the 4 essential questions of a PLC? Rick DeFore at its greatest. It's pretty simple. It's kind of the secret sauce of teaching and learning. What do I want my students to know? How am I going to know if they know it? What am I going to do if they already knew it? What am I going to do if they didn't learn it? That seems pretty simple. Those are really basic elementary questions that if every teacher can answer in their classroom, that's great. But the problem is there's teaching, but the bigger side of our goal shouldn't be on teaching, it should be on learning. So the questions we should be asking really is, can students answer those questions? And every student answer those questions. Okay? So we started talking about how to stop thinking about your classroom through the lens of the teacher. Start thinking about your classroom through the lens of your student. And more importantly, let's go to the very end of the row. Imagine you were doing such a good job in your classroom that not only could your students answer those questions, but every parent could answer those questions. What is expected of my child? How will it look? What does it look like if my child knows what they're supposed to know? What can my child do if they can extend or can move further? Where can my child access help? What does it look like? Where can they go? Can you imagine if every parent could answer that question? What would you guys, we have a lot of parents in this room. How would you feel about that school if every day you could answer that question? Would you feel like that school cares about your child? At least a little bit. Now, these are just structural components. Nothing more than structural components. Just having that assurance builds your confidence just a little bit. And the reason why I bring them up is because those structural components are easy to change. They're easy to control. And they have nothing to do with students or parents yet, right? Because I can't control students and I can't control parents. But I can control the system and I can control the environment. And I can control a culture. Okay? This is USEAP School District's portrait of a graduate. Knowledge, skills, and disposition. The head, the hand, and the heart. Our attempt at trying to show that we structurally and intentionally, I love that term that you used, intentionally made it a priority that all of these things are important. And we have worked really, really hard to establish that academic skills, they are important, but they are 1/3 of what we do. And they are only 1/3 important of what we do. Some people, and I love Sid Dixon, Dr. Dixon's comments about soft skills, don't ever call them soft skills. They are the hard skills, and we believe that too. The skills and dispositions, those are the things that will really matter. Is there anything academically we teach students in school that they can't Google on a phone? Nothing. Nothing. Okay? We can skip that. This is kind of hard to see, but I want to put this up here for you to look at. This is our portrait of a graduate. As we try to, again, going to that idea that we said each student has their own plan. Notice on here, we have these, what's called the 4-year rolling plan. You can see that. That starts in 6th grade. In 6th grade, students are asked to say, where do you want to go? And let's talk about what you need to do for the next 4 years. Now, in special education, this is not new. We do this once a year, annually. It's called an IEP meeting, and we have an annual review of that. But this is done with every child, including students with disabilities, everybody, equally. Where do you want to go? How many 6th graders know what they want to be? All of them. How many of them are actually going to be what they thought they were going to be in 6th grade? A few of them. Doesn't matter. But if I can tap into what is important to them, and you start thinking ahead about social emotional learning and skills and dispositions, rather than me trying to push that onto them, ultimately the better goal would be for them to invest in their own development, in their own learning, to have buy-in. Well, if I'm talking about, I'm going to be, my son, my youngest son, he's an 8th grader now. From the time he's been in 2nd grade, guess what? He's going to be a wide receiver in the NFL. I've coached football. I love the kid. He's 5 foot. No, he's not. That's a lie. He's 4'10" and weighs about 75 pounds as an 8th grader. Unless something magic happens, he's probably not going to be in the NFL. But is it okay for him to say, I want to be in the NFL? It is. If that's what he wants to do, then I'm going to encourage him. How many valuable lessons, how many valuable skills and dispositions does he need to tap into, and can I have conversations with him about that would help him be a more proficient NFL wide receiver? Do you have to work hard?
Yeah.
Do you have to communicate? Do you have to be able to work well with others? Do you have to be able to take direction? Do you have to be a team worker?
Do you have to be able to improvise when necessary? Yes.
There you go.
All of them.
Okay, all of those things. So having this 4-year rolling plan really is about having students tell us, and parents, because parents are heavily involved in, that's a graduated. My 12th graders, they don't talk to their parents. My 11th graders, not so much. My freshmen, they look at their parents and then they put what they want. My 6th graders, well, Mom, Dad, what do I want to be? What do I want to do? What classes do I want to take? Because that's what they're building. From that 4-year rolling plan, they're building, what classes do I take? How do I take those classes? What clubs do I join? And then we put up here some of these essential skills. Things like 25 hours of community service, 95% attendance, and that doesn't count school-related absences. Work-based learning experiences, co-curricular activities and clubs, extracurricular activities and clubs. Pick 4 of those. It's not, you don't have to do all of these, you have to do 4 of these. But then down here, we try to differentiate. Well, you want to go into the workforce? That's great. If you want to go into the workforce, let's talk about some of the things that you need that universally will make you a good employee. You want to go to college? Do you want to go to a college? Do you want to go to university? Do you want to go to an Ivy League university? Because there's a difference, isn't there? Can I be college ready and yet not be ready to go to Harvard?
Yes.
Absolutely. Can I be college ready to go to Snow College? And then this is no slide to Snow College. It's where most of our kids go from USEAP. That's different than being ready to go to the University of Utah. Yeah, that's a true statement. But at least we can start having an honest conversation about what college and career readiness really means. And embedded in those conversations are the ideas around what are the skills and dispositions that are needed for that. So really quickly, skills. These are the skills that you will see in our portrait. So we have 3 portraits. You saw the portrait of a graduate. Okay, and that's what these are. And these are all designed and fleshed out, and I can go into a whole on competency learning. These have competencies and rubrics that are built around them, so you can see exactly what it really means to be proficient in these areas. But at the 5th grade, they have portrait of a 5th grader. And it's broke down to say, for example, under communication, is effective listening for a kindergartner the same as effective listening for a 5th grader? No. That's all differentiated out. But we have very specific rubrics that say, as a kindergartner, your goal, we expect you to be effective listeners. Why? Because effective listening is a skill that's going to help you your whole life. Down at the bottom of that one, communicating in diverse environments. The example that you gave about your son being punched in the stomach. Could that young man, on both sides of that interaction, could both of them benefited from intentional conversations about what it means to communicate in a diverse environment where you're not the only voice in the room? Yeah, those are great skills. Do a lot of our students with disabilities struggle with some of these skills? Do a lot of our students that come from at-risk, what we'd identify as our at-risk students that come from demographical situations that would put them in a position where they haven't had two parents with master's degrees in the home that speak English very, very well, read books to them since they were in the womb every day. We talk about equity. Can they benefit from some of these conversations, intentional conversations? Yes, they can. So these are our skills. And then finally, our dispositions. And our dispositions is where our social emotional learning sits. I know that's a lot of explanation, but I think it's important for you to understand what we're doing and why we're doing at USEAP. So here's where we're at, our dispositions. These dispositions are pretty universal, okay? This comes from ACT's Tessera. We didn't try to recreate the wheel. Our elementaries, this is used in our secondary schools, our junior high and our high school. Our elementary uses CASEL and the Second Steps curriculum. So while they mirror this, their dispositions are worded just a little bit different. There's 7 of them instead of 5. And these become competencies that are intentionally taught, intentionally embedded in every classroom, using common language, used in conversations to diffuse conflict, used in conversations to help encourage students through giving up, through quitting, through poor behavior. How that looks, we don't have time to go into all the different ways about how that looks, but I'm coming at this, and we have come at this as a district, more from what is our intentional effort at an outcome, and we are trying to figure out all the hows to do it, rather than how can we come at this to solve a specific problem once we have a problem. We're trying to avoid the problems. Our kids have very flexible schedules. Our kids can, I love that Kevin talked about self-regulation. Our students will never learn to self-regulate if they don't have an opportunity to self-regulate. They don't have a space to self-regulate. And who cares if a kid is taking advantage of the mindfulness room? We can deal with that on the backside. But if I start trying to hammer kids that I think might be taking advantage of that, or I try to control what is going on to get students into there, I've all of a sudden impacted my students' ability to self-regulate and find that as a safe space, a safe place to go. If I have teachers that aren't willing to listen to students, then my teachers are already going to escalate students and create conflict with students before we ever start. Why worry about all the programs to solve problems when you can just change your behaviors and anticipate that students are going to have problems and do everything you can to avoid the situation? That's more the approach that we've taken. So up here, for example, and I'm going to focus a little bit specifically to our junior high and high school, you can see the 5 different areas here. Ultimately, they all culminate into school climate. But when our students look at this, for example, conscientiousness, which is just a fancy way of saying grit, agreeableness, which is teamwork, these skills that these dispositions that we're trying to develop in students, every other day in our secondary schools, our students actually have a class built into their schedule. We can do this because we adjusted our schedule. We changed the whole structure of our schedule to build time in where they can have a class that they focus on this. And they do it in a personalized setting. We use Canvas, which is an LMS. We have teachers that are trained specifically to help students with this. We've tapped into what's called the playbook, the Tessera playbook. So students go at the first of the year, they take this assessment, 122 questions. It's a pretty big assessment. And it just talks them through scenarios, and at the end it gives them kind of a score. The score is not meant to say you're good or bad. It simply says these are areas in these dispositions that you show a lot of strength in. Others you do not. So we say, okay, you know how things work. You have a strength, you have a weakness. Which are you going to focus on? And the answer is both. I'm going to use my strength to develop my weakness. That's something that's culturally taught in our schools to all students. And it's a common conversation. So our students engage the playbook, and within that playbook, they start to develop and work through scenarios that help them develop these skills. They're also given activities and opportunities outside in the school that hey, you know what, you need to work. Teamwork is an area you need to work on. And for you, teamwork is an area you're really strong. We're going to put you guys in a group together and work as you develop in teamwork or in leadership. And help them try to have intentional opportunities to develop that. We build a vocabulary, a common vocabulary and language. It's amazing how important that little change is in the conversation. We don't need to watch that. But specifically to our elementaries, one of the things that we've done, because I would argue that the majority of where you see the need in our district is overwhelmingly in our elementaries. Their developmental level is such that a lot of the social emotional skills, while they may be lacking, the thing that they haven't developed is really, really good coping skills or skills to work through their lack of social emotional skills. And so in our elementaries in our district 3 years ago, we put in place what we called our skills coaches. And we put one in every elementary. And our skills coaches, we sent them to be trained. They did a week training, and that's not nearly enough, but it was a start. And yes, that training was more around the behavioral training. But with that, it allows them to get started. Their purpose in the elementaries is they just float up and down the hallways. When teachers or students have any type of issues, the skills coaches are able to step in, and teachers will engage with the students and help them try to work through what the problem is and what's causing the behavior or how they're reacting to a situation. And then they simply turn that over to the skills coach. So they can go back to the classroom, to the whole group. The skills coach will continue the conversation, move the student out to the hallway if necessary, work them through some practices to identify what's going on. And the whole goal is to within 5 minutes have that student back in their classroom, back in their seat, and willing to participate and engage. If not, students themselves can self-select and come out, and we do have the mindfulness rooms in our elementaries as well. Our mindfulness rooms, I will say, are nowhere near to the level that Iron County's developed, and we're very much jealous of what they're doing and trying to get better at what we're doing. But the idea of giving students that space to self-regulate and giving students the opportunities to self-regulate. And then as the big people in the building, creating a culture that says it's okay. And there's nothing wrong with that student stepping out of your class for a minute. Or don't escalate a situation just because it's a power struggle. I like Kevin's example of, you know what? I got through this, you can get through this. So, you know, that's not true. We don't understand what every student's coming to our classrooms with. We don't understand what that student's going through. We don't understand that half of the things that frustrate them in school are of our own doing. So if we stop and kind of back up and take that approach, now it opens up the doorways and the avenues for you to now put into place those dispositions or emotional learning skills that will help those students be better successful. So the next time they have a skill to deal with the frustration they're feeling, rather than just be frustrated and not feel like there's any, I mean, honestly, 5th graders, 2nd graders, 8th graders, take your pick. If we don't validate that they have the right to feel what they're feeling, and if they don't feel like they have a relationship in that building that cares enough about them that they can express that, we will lose that child 100% of the time.
So you mentioned that you had classes in each of your schools that are teaching skills like ACT.
The secondary uses the ACT platform. It's just the program that they use.
Okay, so who actually is instructing those classes?
So a lot of them are in, and again, our environment, a lot of them are self-paced. Okay. And independent learning, but there's also a teacher in the room because you may be working on teamwork. Right. I don't need to work on teamwork. I need to work on leadership.
Okay.
Your area that you want to focus on is there, mine is here. So we're going to engage 2 different activities. So it's not a whole group instruction. They do a whole group instruction once a month activities. But for the most part, students are working on their own goals. They're setting their own goals. They're tying them back to their 4-year rolling plan. Where are you trying to get to, and why is this important for you to get to there? What are you doing around, and we didn't talk about this, but what are you doing around your portfolio that you're building? Because our goal is that every one of our students can walk out of our 5th grade, 8th grade, and 12th grade, which is when they leave each level to the next level, with a portfolio built, with evidences, because we're a competency district, with evidence and competencies that show this is my example of, for example, we've talked about in this space, we've talked about students with severe learning disabilities. For some of them, their goal is not to be college and career ready. It is to be career ready, but it's not the same, they don't have the same expectation of career ready than say a student that's going into a tech university or into a tech school. But theirs is, I want to be employable, I want to be reliable, I want to be able to get a job, and that's what their goal is, and that's what their parents' goal is. I mean, they really want them to have some semblance of self-sufficiency in their life. Well, for them, our goal is that they can develop a portfolio of things that they've been able to do. I heard transitions brought up. So we work heavily in their transition plan, which the 4-year rolling plan and transition plan lay right over the top of each other. What can we put in your portfolio? Well, when I was in 10th grade, I went and did some outreach to our local hardware store, and I stocked shelves. And here's some video of me stocking shelves. And I showed up every single day on time. And here's a letter from my boss at the hardware store that says I can show up. That would go into that student's portfolio. That would be what their portfolio looked like, because that's an evidence that they feel like showed an example of them being competent at that skill. And so the same thing is true of dispositions. For example, we talked about leadership. We have students that have chose to say, you know what? I'll go to my severe students. We had one the other day that said, I want you to videotape me because in PE, I'm the team leader. I make sure that all the groups are organized. And I make sure, now this is quite a severe student. I make sure that all the groups are organized and I make sure that everybody's lined up and ready to take roll. So he asked his teacher to videotape him on his iPad. So he had a video of that because he wanted to put it into his. To him, he was identifying that meant an example of me being a leader. So it's just this idea of intentionally engaging the conversation. So then that opens the door to the conversations of, well, what does it mean to be a leader? The traditional schoolhouse, how many of you had teachers in school that would definitely tell you, I taught critical thinking in my classes? Raise your hand. If you had teachers that would have told you, I taught critical thinking in my classroom. Only a couple of you. I would argue that every English teacher you had would tell you, well, I teach critical thinking. Well, did you? Or did you just hope that critical thinking was a byproduct of what you were teaching? You gave students opportunities that if they had the skill to develop that, they would have. But did you intentionally engage the skill? And that's what we're trying to change. So these dispositions become intentional.
So can I ask just a follow-up question? So in that class, then they're constantly reviewing their goal and how they're meeting that 4-year rolling plan that they have, and that's where all of that is happening?
That's just the most intentional place that's happening. That's like where we can say, Mom, Dad, we can tell you that this is happening. Students, you will see this here, but it's happening in every classroom. Those tests or reports or those scores, when my student support team meets, and let's say I have a student that's really struggling, it's a behavioral issue, and it's kind of something that just keeps showing up over and over and over again. When that student's name is brought through the student support team in the school, you have our counselor, as a student support team would. It has special ed there, it has administration, it has classroom teachers. One of the first things they're going to do is they're going to pull it out and say, what's this student's social emotional score? What do we know about this student? The counselors then may bring in the ACEs. What do we know about this student's ACEs score? What do we know about the trauma that's been involved? And again, that's now getting to trying to diagnose specifically. So that's working from the backside. That's reactive after the proactive hasn't been enough. But then when we engage that student, we have a place to start with, and it's a place that they want to be at. That we're talking to them and working with them and working with their parents about helping them get to where they want to be. And helping them see that this particular disposition that's not there, if we can help them develop that a little better, it'll help them to be more successful at reaching that as well.
So, 2-part question.
Yeah.
One of my concerns as a parent for a child with a disability, but also typical children, is, and I kind of find myself in regular conversations with young adults that are in college bound, that too often we have this really high pressure expectation on really young children to have their future career for their entire life all figured out for them. So obviously that can play in social, emotional,
stress.
Right? Because, if I don't have my entire future figured out at the age of 16, 17, 18, then it's the end of the world, when we as adults know that it's an evolutionary process. It's constantly changing. So as you're, I think it's definitely great that they, look at those future, what their end goals are, but as you identified, it can also change as well for them.
And we stress that heavily with them, that this is not anything. This is about just setting a target that you feel comfortable working towards right now.
Right.
And it is, in fact, the comment the counselors always, you will change this. I mean, very seldom are they going to stick with it.
So that was kind of the question, is with everybody that's really that approach and utilizing it, is there that extra
constantly.
layer to help the
Yeah.
students know that,
Absolutely.
you know what I mean? And then secondly, as you're talking about the special education students, with their IEPs and their goals and their future career stuff, like the thing that happens again too often is setting expectations too low. And so what's being done to ensure that, like my daughter has Down syndrome, so she's got the intellectual delays and other things. But, for her sake, my expectations are high so that she hopefully will have the access and opportunities to become her best self.
Right.
So with this approach and stuff, what's being done to ensure that those that are working on those goals and such for those students are really ensuring that their career objectives or their future objectives are looked at with a high mindset instead of a,
Yeah, we're just settling here. And that happens both ways. Because you're absolutely right. Oftentimes parents come in and they have expectations, and this is a little stereotypical comment, but with some of our more severe students, they come in and parents have, they're just going to live with me the rest of their life. They'll never be independent. They can't be. They can't. And we're looking at them going, I think you're underselling your child's potential. And it becomes a conversation, again, individualized. The example I gave of the one young man is based on a mutual understanding of not ever putting a cap on where he could go, but really supporting him to where he wants to go. And the nice thing about him is he has a really, really great understanding of himself. That's been one of his big goals, is to understand who he is, and he's a super senior, and he can see kind of what his goals are, and his parents are in agreement, and the school's in agreement. So that's kind of that triangulated. No one person has all the information, and we get that with just any student, a sixth grader that comes in and says, you know what, I can't do this. And I was going to bring that up as one of the things that come out on our TESRA report right off the bat. One thing that we saw. We all know this student, which is the teacher pleaser. They know how to play the game of school. Just tell them what you want them to do, they'll do it. They know how to get an A. But what happens the second that student has to work hard at something or it doesn't come easy? They have no resilience, they have no grit. Well, guess what we saw right off the bat when we looked at ACEs scores for a lot of our students that we knew had a lot of trauma in their life? And we looked at their resilience scores on TESRA. Guess what their resilience scores were? They were off the chart. Well, for the first time in their lives, a lot of those kids had something they could look at and say, I am really, really good at this. Well, that's about just self-awareness. But it was really great because those same kids, sometimes right off the bat in sixth grade, those kids are quick to just doubt themselves. They don't want to engage. Well, I can't do that. I can't be the president of the United States. Why not? Why not? I have all the evidence in the world. I know you can do hard things. Look at this. And yes, it's one little assessment, it's one little piece of paper, and it doesn't mean everything, but it's the start of a conversation with that child in a positive way that they have never had potentially in their life. So none of this is the catch-all, and I appreciate Kevin's emphasis to this point. There's so many layers, and it's so individualized, and there isn't a wealth of information out there that just says, I'm sorry, there's not do the bullet. If somebody says, here's the bullet points.
That would make it so easy, didn't it?
Because the bullet points, from my opinion, and this is one opinion, there is not a bullet point for every child. But the conditions and the environment to support every child, again, going back to the very first slide, removing the barriers for each, not all children, for each child, has to be in your culture. And it's simply that idea because, I'm not quite sure why I'm presenting in this group, because what we're doing is not earth-shattering, but I will say that we are committed to helping each child, and that's a cultural belief. We'll figure out how to do it. We're going to make some mistakes, we're going to do a lot of things wrong along the way, but the belief that can do what we need to help each child is a big place to start, rather than just say, sorry, we're one size fits all, or our policy is this. That's, I guess, to that point. So, yeah, you make really good, valid points. And it really just becomes, what is the situation with the child that's sitting across the table from you? Because we wouldn't ever want to undershoot or underestimate a child or limit their potential. And on the other side, we wouldn't want to do everything we could to motivate a child to reach beyond what they see or sometimes their parents see as their potential. So thank you, good question. Other questions, or I don't know, Leah, did I even touch on what you wanted me to touch on?
The only thing you didn't talk about that I think they would find really valuable is how you're working with your community partners.
Oh, okay.
Because that's also unique.
Okay, so we have in our district, and I can take no credit for this. This was there long before me. Again, I think it's something that's was easily done in a small community. Because the kids are just our kids. They're our kids 7 days of the week. We have what we call our local interagency council. And once a month we meet and we pull in all of our agencies, from juvenile justice to workforce services to all the schools are obviously there. We have our counselors there, our administrators there, our police department, our sheriff's department. The judge comes when he can. Family advocacy, I'm trying to think, just every Central Utah Counseling, everybody there, the hospital. And we feed them lunch. We have usually a presentation similar to this. Somebody will get up and give a presentation. But then we go through and we do what we call staffing. And what that is we say, okay, we've got this need. We have a child in this school, and this child is struggling, this family's struggling. What can we do as an agency? What can we do as a community to pull together? And we have all the resources together in one room, in one spot. So we can get from juvenile justice to DCFS, to mental health, to family counseling, to Medicaid. All of those people are in one spot, so we can just quickly bring those resources right together right now, rather than, unfortunately, what sometimes happens, the bureaucratic hoop jumping that has to happen. If we were to just go to that parent and say, hey, I'm going to give you a list of people you can go talk to. That's not going to be successful at all. So our local interagency council, one thing that we're often asked about that, well, how do you get around confidentiality issues? How do you get around personally identifiable information? How do you work in that space? And a lot of organizations just don't see how that can happen. So there's a couple of things that we do, and a couple of things that are there. Number one, as we come together, we are now an educational agency. So when you talk about FERPA, there is now an educational need for information about that student to be shared. And all of those people become part of that educational community. That's one aspect. We also have a letter of understanding that was sent to us from the state. And I can't remember exactly who sent it and signed it. But basically, it puts a little bit of buffering to that group for the work that we do. Every single organization there has their own, for example, the hospital or the counselors. They deal with HIPAA versus FERPA. Well, they can only share so much information, but they understand where those lines end. And everybody's responsible for that. We also signed some confidentiality agreements to even be part of that group. That's how we currently do it. In 22 years, it has been a very, very effective, very powerful group. And the thing that it does, like I say, is it puts resources, and all kinds of resources, not in a couple weeks or in a couple months, but the next day. That family is being contacted, they're being notified or we're contacting the family if it needs to be and saying, okay, here is the person. And it's not an office phone number, it's somebody's cell phone number. So is that what you're, is that what you're talking about?
It's pretty unique and fantastic.
It is, and it is a wonderful thing, and I can take no credit for it. Susan Cowan, she put that in place. She was the SPED director before me, and that's been there for about 22 years in our community.
So that was created from the school, like it came out of
the school
district to bring everyone
Yeah,
together that
the
way?
school brought it together. Susan, like I say, she was the special ed director,
Yeah.
and she's the one that started it in the community. And again, when you know everybody by first name basis, it helps. It does help. But I've talked to large districts, and there's no reason a large district couldn't do it. It's just saying that it's like anything. Is it a priority? If it's a priority, we can figure out ways to do it. And all those other things, confidentiality, well, you don't have to go, if you don't feel like you can go to the same lengths that we go to communicate, that's fine, you don't have to. There's ways around that you can still connect those resources. But simply coming together, because I can talk about a student and their needs without ever giving you any information that would identify that student. But yet I could say, here's the need profile that I have. Who's best suited in this room? I don't know. Like for me, I didn't understand, I'll be honest, I didn't understand what family advocacy could do. I just didn't know. I didn't know that resource was until I came to JUAB. And once being in JUAB, the first meeting I went to, they're like, hey, can you do some parenting classes? Because we think that this family can really, really benefit. And they've been asking us, because parents will come into the school and they'll say, I just don't know what to do with this child. I don't know how to react when they do this. I don't know how to do this. I didn't even know there was such a thing. Shame on me, I know, but not even knowing that resource is there, how could I ever direct it to the best parent to it? So.
Thank you. Thank you.
Thank you.
Thank you both for trying. Okay, we have some people here that are going to give us an HB 370 overview. At 11:45. Oh, I guess it's 11:45. 12. I guess I'll cut into our top time section. It's about 12, a little after. We will start lunch, and then we'll have a working lunch. We'll take a minute to get the lunch, and then we will approve the minutes, and then have the community organization updates and the public comment. And then we'll have, after that, we'll have restorative practices and those other things on the agenda. If you haven't had a chance yet, look over the minutes from, I think we sent it out in an email on December 26th. No, they came out just a couple days ago. So look over the minutes, we'll be approving those. And if you haven't signed in, make sure you sign in.
Karen, will be voting on the memo later as well?
The memo?
The previous.
No, it's done.
It's done. Okay.
Yeah, sent off the feed. We don't have time today to discuss that. We need to get on to our next one, and we set that out, and so hopefully people, if they had comments on it, we can make those. So, okay, I'm gonna let Leah introduce the.
So as I told you before, this is Christy Walker. She's the coordinator of the Safe and Healthy Schools team at the State Board of Education. This is Ashley Lauer. I told you we had the 2 school psychologists working on behavior supports. Ashley is one of them. This is David Christensen. He's our school safety data specialist, and they work together as a team to implement and will be making the evaluation related to House Bill 373. So I gave you a little overview this morning of what it is. They're going to talk about to what it's actually doing, which is way more important.
All right, so while Ashley's getting that up and going, Ashley and David have been amazing team members. They've been on board with the Safe and Healthy Schools team for less than 6 months for both of them. And they've really spearheaded the work on House Bill 373. So I'm gonna turn this time over to them for the quickest presentation,
Yes.
right? We will not get in the way of the lunch, we promise. All right.
No, no, it's fine, it's
We
fine.
might smell it while we're presenting, that's okay.
So good news is, we understand you already had a discussion about it, so we've cut our presentation down, so we won't even take 15 minutes. The bad news is we're standing between you and lunch. That's for us. Never a good thing. So let's just start real fast with the application process for LEAs.
So I believe we had a discussion about that the money is to be used for hiring qualified mental health professionals, qualified mental health personnel. The money that was allocated now this year, and then it changes for next year to be a significant amount more for each of the LEs who apply to receive money from this grant. So requirements in the application, which some of you in this room probably know a little bit about the application process. We want to make sure we understand the measurable goals. We have measurable goals and outcomes. What we're actually going to see as these mental health professionals are coming into the schools, as we're increasing the access to mental health services, what are we actually going to see? And this application is on a 3-year cycle. So there's a 3-year implementation plan that really connects what these qualifying personnel are doing or the contracted services and how they will support those goals that are there. They will, I apologize.
No worries.
There's an intent to collaborate with local mental health authorities. So is there going to be a collaboration there? Is there going to be a contract formed between the local mental health authority and the LEA? And then there's training, right? There's training that needs to happen. So it's a description of how is there going to be training on trauma-informed care, and then how are they advising all educators against practicing medicine, giving diagnoses, or providing treatment. It's an important thing to pay attention to.
Quick question.
And then,
yeah, the training for trauma-informed care, is that intended for all players in the district, or is it just for the professionals that are rolling out the program, or like who has to get that trauma-informed care?
Everyone in the district.
Okay.
Yes, good question. And then reporting, so there's parent seminars that are expected to be happening as well, and so reporting the number of parents. So it's actually the application reports the year before and how many parent seminars happened and the number of attendees in those parent seminars. So how are we collaborating with our families as well and making sure they have information and are provided that information as well. So David, being our wonderful data guy, is going to share, we just have a really general picture of the qualified personnel who have been hired or contracted with so far.
Right, so it's just a snapshot of the initial projections. In August, this came out. So we had 39 of 41 school districts that submitted plans, 3 regional centers, and 38 charter schools that all submitted plans. We're seeing that there's an additional FTE of 188 and a percentage increase of almost 18% year over year.
So we'll skip a slide so we can tell more about what we've actually seen so far, and then we'll come back to some of the goals of what districts are wanting.
Yeah, so just looking at hires by personnel and data guide looks, this kind of stuff, bar graphs, I mean, it's cool, right? So school counselors, that's 80 school counselors have been hired, followed by social workers at 59, contracted services, 26, and then the ever important and critical school nurse, 25. So those are the top 4 hires that we've seen.
And then coming back for a minute, we had vast goals that were reported on these plans, on what LEAs felt like they could really use, where we could see the impact for our students. And so there were a lot of goals surrounding decreasing absenteeism, just having an impact on that attendance to get our students in the schools to be learning, decreasing office referrals, hopefully teaching some skills so that we see our behavior decreasing, and then increasing access to mental health resources that included providing information, providing counseling, both in a group setting as well as individual, and then skills building as well. And we talked a little bit about coping skills. That was a big thing, is really providing coping skills to our students. And then, increasing achievement as we're seeing the skills building in social emotional areas, right? As we've talked about, hopefully that will also build that achievement. And then decreasing mental health concerns, specifically looking at decreasing those self-harm behaviors and suicidal ideation. So we're wrapping up already. So lunch is coming soon. But important to know, so up to as of December, there was 12.3 million already paid out or awarded to the different LEAs. The LEA said 184 qualified personnel that have been reported that have been able to be use this funding. And there's been a lot of stories already coming in. We don't have the hard data yet on the progress that'll come with the accountability report at the end of the school year, but a lot of great stories of how these personnel have impacted the schools in a positive way, impacted our students, really increasing that access to mental health services. We know that we do have a lot of students, as we've talked about ACEs, as we've talked about trauma, a lot of students who have been impacted, and we've been able to, through the personnel hired in that important contracting with outside mental health agencies as well, kind of support our students in that needs. And then that accountability report that'll come out at the end of the school year, they'll report on progress, on the goals, as well as there's going to be information about the impact on the community. What are we actually seeing? And that'll be really important. I think Dave is especially excited to have some more data to look at and how we're really impacting and seeing positive outcomes for our students.
Yeah.
So I know, we probably have some quick questions. I don't know if we want to have people start eating lunch and then ask questions or what.
I think we're going to do questions on lunch. So.
Yeah. Okay.
My question is, it looks like there's a large number of school counselors that's great. I think that's fantastic. And I don't want to discredit the work that they do because it's tough. But often they're asked to do multi-tasks, right? Where they're doing more college and career and a little bit of maybe crisis intervention, but college and career kind of stuff. And so how are we monitoring that kind of stuff? Where is it a dedicated school counselor that's there to help with that social emotional learning component? Or is this school counselor, like a lot of our school counselors, spread kind of thin that way? And also, what is there? I don't know, is there a push to get more like clinical social workers or school psychologists in the school to do more of that mental health work versus what a school counselor really ends up doing?
Real quick, if I could piggyback onto that, and specific training working with students with disabilities in counseling.
Yeah, there really isn't.
So just if I could tag that on to what she's already asked.
Yes, and so let me try and address them both, okay? So what you see in the hiring pool and the numbers in each of those areas, we don't have any data to directly support this statement, but it does seem to be pretty indicative of the hiring pool that's available across the state. So there is more counselors than there are social workers, than there are psychologists. And so I think what you see really does mirror those things. That being said, as far as their job title and their role and what they are required to do within that role, we have found that because LEAs had a lot of latitude as far as identifying the needs according to their data and then hiring that personnel to align with that goal, the school counselor, for example, if they were to hire a school counselor to fulfill certain duties, if they are utilizing the comprehensive school counseling and guidance program model, that counselor could be pulled into college and career readiness and some of those things, but utilizing House Bill 373 funds, that individual needs to be fulfilling duties that apply to the goal. Now, as far as like oversight to ensure, the percentage of time and how that's being utilized, there isn't oversight along those lines, but in the accountability report, they will need to show how that personnel impacted their goal. So does that answer your statement?
And you have elementary school counselors in elementary, right, doing this as well?
And
Yes.
we have another that separates, and there was 50, I believe it was 56 out of the 80 who were directly, actually 59, because there were a couple who were doing both secondary and elementary who were directly working in elementary schools.
Right. Yeah, so hopefully that answers your question. Then as far as our ask for reporting as far as direct services to students with disabilities, there's not anything on the accountability report, which could be considered because that's not something that's been finalized. But also on the application, but that is something that we can look at addressing and increasing the data around.
On that, would
Yes.
that be a board recommendation necessity, or do you guys have the autonomy to add that on your own?
So the application has elements that have been approved through the board. So we do have to look at what's included in legislation as far as accountability, what's in board rule, and then there are things that were added to streamline some processes. So,
but as far as the special education accountability component, you're saying it's not specifically addressed. So what we do as this group is we've started this theme of like recommending to the board certain items. So would this be a good thing to utilize through that, or can you guys just make that change on your own without having to go through board approval to add this particular accountability?
I'm gonna look at Leah on this one. What are your thoughts?
It would be simpler if it was a recommendation that the board approved, but not that we couldn't try to do it on our own, but
Added to the recommendation items.
Thank you.
Is there a breakdown as far as the funds between elementary, secondary, and then also a breakdown between like services we provide between regular education and special education data available as far as the funds being spent in that direction?
So I believe we have some data as far as what grades they're serving. That's something that wasn't spelled out specifically within the application. You can draw some data, some soft data points around what grade levels they're serving based on the school or their goal. But however, when you get an LEA, so here's one gap in the data right now, and David, you can shoot a roll at me or something if you want, but right now, because the application is done by LEAs, the hiring of the personnel is coordinated through the LEA. So if you have a very large district, then they could say, hey, as this district, I'm not going to use an example, we're going to hire so many counselors. We're going to hire 12 counselors and 5 social workers and 2 school nurses. And then we're going to utilize their services to address these goal areas. But nowhere does it say specifically to work within this school or that school or that grade level. You know what I'm saying? Because it's possible they have a very comprehensive tiered model where they're addressing those tiers, and then these are individuals that go out kind of as needed as well. And so that's something that, I mean, it's tricky to get exact data around the grade levels that are being impacted, but that's something that we could also look at. And
does it seem like most of the plans are focusing sort of on the elementary K through 6 age group, or are they sort of around?
It was varied. There were some that were
There's
specific,
a lot of
but there was a
variation.
lot of variation.
Yeah. I just wasn't sure if like as a whole state, if we were honing in like we do with reading intervention at very early levels or.
It was very context specific.
Yeah. Okay, we've got a few. I know you had your hand
No,
up
you're good. I
first.
just have a numbers question. So back to your slide where you're saying how many people are hired. I know that when Leah was explaining this to us, each district or each school has to supplement or they have to match the amount that's being. So you're giving us a number, but really that number's doubled. Is that what I'm understanding? If a school is required to double the amount of funds that is given out, are they then using funds to hire even more people than what that number is showing? Or just explain to me how that's kind of how that doubling amount works.
So the number, so the monetary amount, yes, you would have to double that because it's a 1-to-1 match.
Okay.
But as far as like the hiring of personnel, that could be including their match. Does that make sense?
Okay, so the 184 could also include the school's amounts. Is that what I'm understanding? Okay.
Yeah.
So it's not just necessary.
For example, our district, our match to what this new grant offered our district because of our size was barely enough to hire one person. So it only counts as one person, even though we paid for half of it, the state grant paid for half.
Right. Yes.
That gets to the question about sustainability. Is there a place that we could look to see what the sustainability is past the 3-year cycle?
Past the 3-year cycle.
Yeah.
So right now the funding is ongoing. So this coming fiscal year, they actually have $26 million allocated for these same services. Last year it was $14 million. And so with that being said, there has not been any adjustments to the match. So although there is additional funds available, they still need to match it 1-to-1 with new monies. And
So as long as this initiative is in place, there's funds. But if this initiative goes away, is there a plan for sustainability, or are we just hoping that this initiative will stay in place?
right now it's ongoing. So we're just, yes. Yes, let's start.
Just concerned about the Wasatch Front. Often a lot more resources along the Wasatch Front. How do these numbers play out in terms of who's applied and who's been able to hire people? Wasatch Front versus the rest of the state, making sure those that need it get it. Have those numbers yet?
I do have them, I don't have them here, but I can give them to you.
I'm hoping the entire state's getting access, not
Yes.
as a practical.
Yes.
As we look at those who have applied and those who have already reported who they've hired, there's only, I would say, I don't have the exact number, but 5 or 6 who have applied who haven't yet reported that they've hired everyone.
But you're seeing those applications pretty spread across the state.
Oh, yes, sorry.
Yeah.
No, that's, no.
Yeah. Yeah, good question. What's that?
When the applications are.
Every 3 years. So once they're approved, they have 3 years that they see on as approved, but we can't, so somebody didn't apply last year, so we have several charters that didn't apply, but if they do apply this coming year, then they would start their new 3-year application. Yes.
Mine is just a comment for the group larger, because people were asking about this money and how it's spent on kids with disabilities. Is that what I was hearing people say? So I just wanted to make the comment that our district is accessing this money, and kids with disabilities access it the way anybody else does. Like, they go where the need is, just like you were describing. So if the need is where there is a child with a disability, they go and they attend to that child. However, if it becomes a situation where that service is required for faith, then I would need to pay for that. I can't use grant money to provide special education services to a student, right?
Correct.
That's
So just so you know, if it became apparent, I mean, kids are in crisis and it's not necessarily part of their IEP, that happens all the time. So that's where they access the money. If it became something that was a required service on their IEP, or they can't access FAPE, then we can't use this kind of money for that. That has to be special education funds that provides that.
Or other non-restricted funds.
Right, just so you guys
These
know.
funds are restricted to the school-based mental health program.
Right, so that's all they can be used for. They can't be filtered into other
things.
Right, thank you. Yes.
Has that been actually dissected? Because I think that obviously it's coming from the legislative bill and so you're functioning with the parameters that's established. However, we all know that most bills are flawed. And just heard a legislator make a comment last week, which just boils my blood and I haven't torn them up yet. Where basically the analogy was on this tax referendum that they fund the horizontally poorly, but vertically they fund well, and they said that special education is funded well. And I presume, and get to the Q&A before I have to depart, I presume that is coming off the federal monies coming in, but this plays into this because at the end of the day, if your main structure is not funded well, then nothing's funded well, regardless if it gets extra monies or not. So with kids with disabilities, if all of a sudden they get referred to IEP, this is monies that's supposed to go to the entire student body, but the moment that they get referred to special education and get their IEP, that money is no longer accessible for that student. That seems a little discriminatory.
No, it's still accessible, it just can't be related to the program, not the IEP.
Well, but you were saying that once they get referred into.
No, what I'm saying is it depends on why they're accessing it. If it is if I'm a student with a disability and something terrible, I have a traumatic event in my life has nothing to do with my disability, I can access this until the cows come home.
Right.
If what I'm experiencing is part of my disability and I require mental health services as part of my disability, then that needs to be special ed money that goes to that. So it doesn't matter if it's pre-referral, post-referral, it's why do they need it?
Yeah.
And where does their disability, it's almost like a manifestation determination kind of thing, right? Like, so that's kind of how you look at it.
Yeah. And
It's tricky.
Right, and I still kind of struggle with it because at the end of the day, whether or not it's a diagnosed disability that results in an IEP and have subsequent issues that correlate to this versus like a trauma event or whatever, there's still something that is manifesting a behavior that would then tap into this recently at this funding stream. And so, I don't know. I mean, I know you're still limited. It's something that bugs.
And didn't you say it's related to their goals though? So it could be a class-wide, a counselor or social work coming in and providing support to a whole class or even a class of just students with disabilities. Will go in and provide a support for all students there or all students in the general education.
Yeah.
So they're receiving that.
So for example, a school counselor who provides services to all students, if they're hired through these funds, the student fund and IEP would not be restricted from accessing that counselor.
Right.
However, the reason I asked my question about working with students with disabilities is we know, and we've seen it in the research, and we know just practically that students will maybe seek school counseling, but then be referred to special ed because they're part of special ed. And so I'm not going to see that person because I'm a school counselor and they have an identified disability and they're in special ed. So I'm going to have the special ed avenue take care of that when we know that's not adequate to meet their needs, because the special ed teacher or the paraprofessional, so on and so forth, aren't necessarily trained to deal with the trauma issues, right, or the other issues. I'm not talking about something that's tied to an emotional behavior disorder, right, or something identified that way, but it could be, it might be. And we know we have counselors that are in the hiring pool that have never worked with anybody with a disability and never taken a class or been trained in any way whatsoever in how to work with people with disabilities. So that's a concern. And I just wonder, how we're addressing that on a larger basis, a conversation that we're even here. There's a separation of who does what, right? It's not a whole school or comprehensive support.
Depending on the LEA.
Is there in this fund, so one of the things I've heard a common theme, and this isn't just here, but talking to other teachers and district leaders and things like that, is the idea that there's just not people out there, right? There's not people who want to come to school psychs, there's not people who want to come to these other positions, type of thing. Is there inside of this funding mechanism a way for them to address disorders such as by training through other like taking teachers from saying, I know it's probably, it's not a teacher's thing, but taking teachers who are successful and moving them into those positions, pursuing licensing, is it strictly they have to have been established?
They have to be established, licensed personnel. But one thing a lot of LEAs have been doing is contracting those services with outside agencies. There's also a lot of conversations around telehealth. That's also something that's acceptable through the study. But as far as taking professionals and moving them into the licensure programs or paying for that, or that's not available through the study.
Okay, thank you.
All right, thank you.
Okay, so we'll take about 15 minutes-ish to do lunch, and then we'll,
Sarah's next. Sarah Young.
Oh,
The portrait of the graduate.
okay.
She's here.
Oh, thank you.
Oh, so we're gonna do her
You choose.
during lunch?
But as far as, yes, we're gonna do her during lunch.
Okay. Should we do her first before we do we'll do her before the stuff? Okay. So we'll take till about 12:30 to get lunch and get situated.
In the back that I'm like, this is always the best time to present because people have stuff in their mouth, so there's no questions. But it is great to be here. I appreciate it. Just brief introductions. My name is Sarah Young. I work for the Utah State Board of Education. I have been a member of that agency team for 8 years in different roles and kind of different project aspects. So my current title is I'm our Director of Strategic Initiatives, which means I'm kind of a behind the scenes jack of all trades in regards to partnering with staff who have individual expertise to help them build out their programs, especially new grant initiatives that can be available for the community so that we can turn those around quickly and make sure that as resources become available in public education, they're making the transition from our agency to the field where they have the most impact. So today I'm here to talk to you about Utah's Portrait of Our Graduate. So what I'm going to do is just give you a brief overview of the process we went through to develop this document, highlight the key components as well as our next steps as an agency to kind of actualize this vision into public education. I'm going to try and do that as quickly as possible, noting to try and get you back on track with your agenda, but also to leave time for questions that you may have in regards to this work. So the way Portrait of a Graduate started out was actually through the Utah State Board of Education convening a task force around graduation requirements. And as part of the conversation with our policymakers and board member representation in that space, the question really started to emerge, what is the outcome of the K-12 education system? Is it a series of I took this many classes? Is it about, that I was able to perform to X degree on the ACT? Like, what do we see for that as a community? And what we noted is we didn't have that really clearly articulated for ourselves, let alone to the broader education community, which made it really challenging to address the question of, so then what should be the requirements for graduation? So rather than going out to the community and saying, what do you think graduation requirements should be, because that is all over the place, we really recognized that it was important that the vision for the outcome of K-12 education wasn't just about what the policymakers or our elected officials at the board thought, but really had to be an agreed upon set of characteristics from the broader community. So as a part of that, we went out to the field and we actually ended up doing over 20 different stakeholder input meetings. Some of them were just public meetings where we had individuals come. We did one online setting. We also targeted specific groups in regards to making sure expertise was noted. The one I'll call out specifically is our students. So we had an opportunity to meet with current K-12 students as well as some freshmen and sophomores at Weber State University to have them reflect on what were the outcomes of the system, where do they they feel like their needs were met, and where did they feel like there was opportunity for growth. As a component of that, we use design thinking. So instead of just asking the question of what do you think the outcome of education should be, we asked slightly different questions to try and get at that idea, such as along the lines of, if you were bringing a new member to your family, what characteristics would you hope that they have? That one sticks with me because it was our Weber State freshmen and sophomores who came up with their comprehensive list, and then they would reflect to each other like, I could be in your family, in regards to seeing those characteristics within themselves, and feeling like that was something that was important to them in regards to the broader vision. So as a component of gathering all of that input, we then created a draft. We put that out for public comment, which then we did receive additional feedback on, and that led us to the final outcome, which is our version of the Utah Talent Map. So the MAP in true educational fashion stands for an acronym, but it's mastery, autonomy, and purpose, which is how we've kind of categorized the different characteristics that are a component of Utah's portrait of a graduate. So I'm going to take you through those elements just quickly. So it's important to note that these are characteristics of Utah graduates after going through the K-12 system. We do provide additional clarification in the document itself that says these are characteristics that begin at home and are fostered in the educational community. So it's important to note we're not saying that schools and teachers and principals and counselors are, solely responsible for these outcomes, but we really see it as a community effort around the whole child. The second component to that is making sure that it's linked to the USBE vision, which is that all students are prepared to succeed and lead by having the knowledge and skills to learn, engage civically, and lead meaningful lives. So in the breakdown, we'll start with mastery. With mastery, we're really looking at the ability to demonstrate depth of knowledge and skill proficiency. And that's broken down into these 4 categories. We have the traditional academic mastery, which is an expectation of school. We don't define it in specific subject areas because the moment you create a list, it's exclusive and somebody's left out. So we really look at it as the comprehensive academic efforts of our schools and having mastery of that content space. We also have wellness. Wellness is really not just looking at kind of an understanding of health as well as kind of the social emotional awareness that we're looking for, but also expanding it to wellness in your engagement with both adults as well as students within your environment and how you foster those healthy skills around that component. We have civics, financial, and economic literacy. It was one of the pieces that our former students called out directly. So many of them are living in that world and for the first time having to be responsible for a lot of their personal expenses and finances. I know there's a child in my household who was shocked by how much shampoo cost when he had to procure it on his own. And so as a component of that, we want to make sure that our students aren't shocked when they all of a sudden have to take on those responsibilities. And many of them reflected on seeking additional guidance and help, specifically when it came to school scholarships as well as post K-12 opportunities in regards to how do you make that transition from living in a parent household where a lot of those things are taken care of and then having that responsibility moving forward. Digital literacy is also a key component. That was called out by a lot of our industry members in terms of it's a rolling expectation now that as you start to be able to come to engage in the workforce setting, you have familiarity with the basics of technology and how those tools can support you no matter what type of scope of work you can use moving forward. Moving on, we have autonomy. Back to kind of the key. Autonomy is about the self-confidence and motivation to think and act independently. We really look at these as a lot of those core skills that aren't always necessarily articulated to our students and yet are an expected outcome as they grow and mature. So communication being key. I'll say that when we put out the public draft, that was the one element that everybody agreed on in terms of that no matter what role or outcome we have, our students need to be able to communicate, and not just verbally, but also in a written format as well as through digital content that they may produce. Critical thinking and problem solving is another key component, again, reflected by our business community. They find that a lot of their new hires tend to be oriented towards just tell me what to do and I'll do it. I think we also hear that from a lot of our teachers, where they say kids are very grade focused, not necessarily learning focused, where they're like, just tell me what I need to do to get this many points, as opposed to I need a better understanding of simple machines because I'm still struggling with some of those pieces, and differentiating that component. We have creativity and innovation, again, that incorporation of the creative aspects, including the arts, and being able to not just be able to reproduce something that someone has handed to you, but also to be able to think on your feet and to create and innovate within that space to iterate and improve on those products. And last but not least, in autonomy, we have the collaboration and teamwork element, that ability to work with others when it comes to kind of group dynamics and what that looks like. I have a son who's in 5th grade, and at the start of the year, he came home and was like, oh, every other group is so much better than mine. I have someone who only wants it done their way. I have someone who's not paying attention to any directions, and I have a third person, you know, who is like very disengaged just in general in regards to the content of the classroom. And I was like, sweetie, that is every group you will ever work with for the rest of your life. And so it's not about like, gosh, I wish I had had other students around me, but it's about building that skill set of how do I work with different personalities in terms of being able to be successful and achieve outcomes. Last but not least, we have purpose. So this is a very, I don't want to say different lens, but it definitely starts to bring in elements that oftentimes we've considered to really be primarily skills and characteristics they see at home, and that if they had opportunities in the school day, that those weren't necessarily required by the system, nor were they always intentional besides a teacher or school choosing to engage in that specific aspect based on the own kind of comments from the community. So this is where we start to see honesty, integrity, and responsibility, looking at those elements, hard work and resilience, lifelong learning and personal growth, really focusing on that, instilling being a learner throughout time, always being able to receive feedback, to be able to continue to improve and learn, service as well as respect. And those kind of captured in the last elements of the comprehensive Utah Portrait of a Graduate. So in terms of a process where we are, is the Portrait of a Graduate has been published. It is part of a larger conversation around education for the whole child, not just education towards the achievement of individual test scores in grades 3 through 8 and the spaces that we test. And where we are as an agency and moving it forward for the community is developing those into competencies so that it's not just this broad vision of we hope our students achieve, you know, collaboration and teamwork, and good luck to the schools in regards to that, but being able to articulate what does that look like. So currently we are in the process of procuring some technical expertise. We will be developing P20 competencies, and that's a different step for us because Portrait of a Graduate was pretty specific to K-12, and since then we've had conversations with our partner at the Utah System of Higher Education, as well as some of our counterparts at DWS in the early childhood space, in talking about is this something we can approach systemically across all of our agencies, and we've received early buy-in in regards to having those entities represented in this development process. The alignment is the Portrait of a Graduate, so the competencies that I just outlined, that's what they will become. Then looking at what does that look like in a K-2 space? What does that look like once you hit 9 through 12? And being able to provide additional resources in that space. We are aligning it with the Utah Competency-Based Learning Framework, which is a document in our agency that speaks to being able to develop competencies where students are being able to advance based on outcomes as opposed to based on just singular inputs where it's like, well, I taught it to you. And it's not about that. It's about, no, a student has demonstrated their competency in this area and therefore have that opportunity to move forward. We also have CASEL in terms of SEL core competencies. The state of Utah under the direction of Dr. Voorhees, was selected as a state to begin in the early work of what does the CASTLE framework look like in regards to state policies here. And so we want to make sure that those social emotional learning components are a part and coherent with the development of competencies moving forward. We will be, it does require a convening of Utah stakeholders, so these will be developed by Utah stakeholders, not by an outside entity and then vetted here. Like, it's about the facilitation of the internal conversation. And then we will have a review period for those who are not able to participate within the development space, that we have that opportunity from the broader to community to get feedback about what does this look like, what changes do we need to make. That was really important to us in Portrait of a Graduate. It yielded a lot of significant changes, and we want to make sure that that's happening here as well before we have kind of refinement and finalization. Once the competencies exist as a resource, we have the opportunity for local implementation. Now, it's an opportunity, it's not a requirement in regards to the competencies are really serving as a guiding document, not necessarily the final document at the local level. We really want to empower each of our districts as well as our charter schools to have conversations with their community about what does it mean to graduate from our system and how are we reflecting those specific to the needs and the resources available in our community. In regards to that, this kind of broader vision of developing competencies is really about helping to empower our learners. In conversations with students, not just here within Utah, but kind of generally across the nation, many of them feel as they're the receivers of learning in a school environment versus being able to shift to empowering the students to be an active driver of their learning in regards to what those next steps look like and giving them that opportunity to have that voice as well as that active role in the planning of moving forward as opposed to they're on a game board and it's already laid out for them and we're just stepping them through it. A component of that is being able to, up in the far corner, develop that student agency piece. It's a component that has to start at the youngest age. You can't show up as a high schooler and say in a school environment, so what do you want to do? Because by that point they're like, no, that's not how school works. Like, school is about you are going to tell me what classes I need to take, and I'm going to do that to check the boxes that have been outlined in policy to be able to move forward. And so we really have to start with our youngest students to be able to develop that mindset over time so that it becomes a part of the broader conversation, as opposed to the first time students are asked about what do you want to be in life is when they hit their CCA plan in a middle school setting. But instead, it's something we're fostering over time. Last but not least, this is part of a broader component of one of the agency's 4 strategic goals, specifically within the personalized teaching and learning space. So the state agency has committed to each student and educator having access to personalized teaching and learning experiences and being able to start to take a look at all the different components, both regulatory, policy, and resource-based at our agency, and saying where are we fostering this and where are we inhibiting this, and being able to work together to be able to address some of those components moving forward. You'll see that we have individual strategies underneath there, but they all stem from kind of that broader vision. So I know that was a lot very quickly. I used to teach middle school kids, so I talked as fast as they did. So I apologize if it was too brief. I'm happy to make this resource available to you, but I'm also happy to answer any questions you may have before we reach kind of the end of my time.
Quick question. So the Portrait of the Graduate, in Utah, where we have the sort of dual pathway, right? We have the certificate of completion and then we have the graduation. How does this tie into that pathway?
It's a great question. So in regards to current definitions, we haven't made any modifications to either pathway or honestly either outcome. So the previous graduation requirements still stand in regards to being tied to course credit. I will say that our policy board members are very interested in shifting to more of an outcomes base as opposed to that input of how many classes did you take. But they were were ready to make that jump, and I was like, we don't have competencies yet, so like let's not make a decision about something that doesn't exist. So we expect to be able to have more of those conversations once we have competencies in place that then you can truly look at and say, so is this something we can move to, and if so, how do we do that in a thoughtful way?
Would those competencies be, how would they be general overall competencies for all students, or would there be separate ones for sort of the students based on level of severity and need?
So I think one of the things that we are very thoughtful about as the kind of diverse staff who's working on this, because we come from very different departments and different sets of expertise, is that when we're developing competencies, one of the components is we really want to view them as for all students, not for, well, these are for our gifted and talented students, and these are for, you know, our students in a traditional program, these are our CTE students, these are our special education students. We're really trying to set that at the high level in terms of vision. I say that recognizing that there's some legal battles going on in other states right now around the elimination of gifted and talented in terms of saying it's inherently inequitable of the students who've been able to participate versus the broader population. And so we'll, like, clearly we keep an eye on those things in regards to wanting to create that overall and broad system. But at this time, we don't have a plan to be able to say we need separate ones. We would certainly, like I said, be open to conversations and feedback from the community once we have that initial draft of what does that need to look like to best support our kids being successful.
You mentioned some collaboration with, you called it CASTLE, which I looked up was Community and Academic Social Emotional Learning Foundation, maybe? What is that?
It's a National Technical Assistance Center that provides technical assistance to states, agencies, school districts, like they'll provide technical assistance to any great website.
And what is Utah's involvement with that?
So I don't remember if you had come in. Okay. So Utah applied to receive intensive technical assistance from them, and so we have a state team that will be receiving technical assistance from them.
Thank you.
Any other questions?
Thank you so much, Sarah.
Thank you. Thank you. I appreciate your time today.
You know, actually, before she's gone, because I'm all memo person today, the recommendations on that competency point that you were just talking about, how you guys are looking at that. Again, look at that as conversation around a recommendation, because like not digging into it in full, my gut reaction is we want to keep the competencies high and uniform, because then the IEP, the goals are set to be individualized, but directed towards either grade level, their typical peer grade level competencies. I'm sure I'm slaughtering the language. So to potentially change those based on the group that they're directed towards might not set as high as expectations for the disability population. So I would personally be hesitant to create separate bars, for lack of better words.
Didn't you say you're not going to do separate?
Well, you said that you might
So
look
we're
at
not.
conversation, not currently.
Yeah, we're not currently. So I think sometimes I could say I'm guilty of this as state staff. Like we get up here and we're like, oh, we have it all figured out. And in this particular case, this is not one of those where it's like, oh, I know exactly what it's going to look like and exactly where we're headed and exactly what that outcome is. So when we're presenting on it, especially in this early phase, I want to make sure that myself as well as the other staff who are working on this, that you know that we're very open to feedback in terms of what makes the best sense, and we're looking for that expertise. But we're also, we also don't have that intent currently, unless it was something that then this whole body agreed upon and was like, we want you to consider that.
And all of that is fabulous and based on that openness, and it's not set in stone. I would think it would be a healthy conversation or recommendation that we identify and provide that feedback to you and your team, so we don't go down a path that really isn't in the best interest of the disability population.
So would we say that we want to keep as they're planning the, setting out the competencies, that we want to keep those high? Or would that be a useful thing to put in the memo? Would it be just as well to talk to the department that's working on it? What would be best?
No, I think that's something if you had consensus on that you could put in the recommendation memo.
And is it something that we need, that we could do in this one, or do we as a group need to dive into that better to really understand it more in depth versus this quick overview? I like I said, I've got my gut instinct, but I really don't have all of the information to make it informed.
What is the time frame for having those competencies drafted?
So the proposed timeframe, which I think our technical assistants might be like, you must be joking, is to have a draft available for community review by no later than May 31st.
This year.
Yep. In terms of that first kind of iteration of what it looks like. The reason we're pushing for that is kind of two reasons. One, we want to be able to get teacher feedback, and the summer setting has a lot of already built-in conferences at the agency level, so that we're not asking people to do something outside of those commitments. We can do them within those commitments. But the second component is we also want LEAs to start to have that opportunity of like, what does this look like? Do we want to adapt these? Do we want to try some of these out, and what does that look like? And to kind of have that conversation before we hit fall and or the January 1st of 2021, which is ultimately that fall of 2021 is when we'd ask LEAs if they were interested in piloting. We just want to give plenty of time to the community to have at least a draft document to start those conversations with their stakeholders before we move into what that looks like. So, yes. Fingers crossed on the 31st. We're taking proposals right now for that technical assistance. In those proposals, the field will let us know, is that feasible or is it absolutely not? So I'll be able to give you a better outcome once we've identified who that technical support will be.
Thank you.
Thank you so much, Sarah. Thank you.
Okay, we are, let's see. Okay, next we're going to do the USEAP business that our scheduled time was 12:25. Sorry, I had the wrong agenda. So does anybody have any suggestions or any changes to the minutes? Well, let's approve the minutes first.
I make a motion to approve.
Okay, who did that? Amanda? Okay, do you have a second?
Second.
Emma.
And
Emma? Okay, all in favor of approving the minutes as written, say aye.
Aye.
Okay, great, that's done. Okay, now we've got our community organization updates, Disability Law Center.
Yes. So I have two. The first is, one of them, I'm not sure as well. So the first is that Disability Advocacy Day is January 30th at the Capitol. It's an event sponsored by the Center for Persons with Disabilities, the Disability Law Center, the Utah Parent Center, and the Utah Developmental Disabilities Council. It's a pretty big day. There's a self-advocacy training in the morning. Then there's a program from 1 to 4 that includes Lance Robertson, who's the U.S. Assistant Secretary for Aging and Chief Administrator of the Administration of Community Living. That's exciting. And then at 4 o'clock, there's a reception and then an opportunity to speak with legislators. If anyone's interested in attending, Susanna Canton at the Disability Law Center is handling registrations. You can find the event page on Facebook. You can go to our Facebook page, Utah Parent Center, any of the sponsors, and find the event page and read all about it there, and then contact and register. The second thing is that at the Disability Law Center, we're currently recruiting for a new HANI Council member. So our HANI Council is the protection and advocacy for individuals with mental illness. So this council advises the Disability Law Center on the priorities and policies
that guide the work to protect and advocate for the rights of Utahns with mental illness. So we're hoping for a parent of a student with mental illness or people that are knowledgeable and interested in helping with that work. If anyone is interested or knows anyone who's interested, please feel free to email me. This is kcox@disabilitylawcenter.org with a very long email address. And I'm happy to connect you that. You can also check out our website. There's an application there as well as an overview of what the work looks like.
How many positions do you have?
Right now we have one.
Okay.
But those come up every now and then.
Okay, thanks. Division of Child and Family Services.
So that was Tanya and Aubrey Story, I think, is going to be replacing Tanya.
But she's not here today.
He could not be here
Oh,
today,
that's
but he's
right.
looking forward to joining us in the future.
Okay. Okay, Juvenile Justice Services. Okay. Teresa.
Yes, for in the early childhood space, so like the birth to 5 years. One thing out of our office, we're updating the early childhood standards so that go along with the kindergarten basically, align with other standards. And the last public comment was held last night. And Brian used to work on this team, so I'm looking at him. He was part of the early childhood team at our office, so worked with him on this, so didn't add anything there. So those and their standards for 3 and 4, and we've had teams working on this, and looking with teams of professionals that also work with students with disabilities. And so those were up, and so there is a place on our website if you're interested to give feedback. It's on our website, and if you just go to early learning, it's one of the banners that go across, and there's a place you can give feedback in all standards. The thing about early childhood, you had to write standards in all developmental areas, where older, like elementary, you have special, you have different standards. So if you have an area in one area, or interest in one area that you want to just review those standards, you can. You don't have to do all of them. So that is going on.
Is there a separate survey for that, or do you just respond only to the
Well,
questions?
you pick, it's like a Google form, so you pick the subjects you're interested in reviewing.
Oh.
And then the next page will pull up the ones that you're interested in reviewing. So public comment, it went through the board, and then now it's in that public comment period, and then we'll take the comments, and then it'll go back to the board to be approved. So that's a big thing in the early childhood.
And that was till February 4th or 5th?
February 5th is when the 90-day comment period ends. So if you're interested, and especially if your subject matter, make sure what we're doing early child is tying to older standards as well. We're doing statewide preschool workshops. We finished one last Friday in Brigham City, and tomorrow's Sandy, and then next Friday we'll be in St. George. And for Brigham City, we had, you guys probably are aware of this, we had Help Me Grow Utah out of United Way. If you're not familiar with that resource, there's a lot of services for families, especially young kids. Help Me Grow Utah. So it's something that's so for the Part C world, so for the birth to 3 world, Help Me Grow Utah is coming to the upcoming ICC Interagency Coordinating Council meeting, similar like this, but for the Part C side, to talk about Help Me Grow. And so focus on in both areas is like in Part C and preschool. Part B is social emotional learning. So we've been doing work on that with LEAs, and Part C has been doing family engagement groups around this issue, around social and infant mental health, particularly in Part C, looking at how we can coordinate better infant mental health, which is really family mental health at that age, with some of the families in that Part C or that birth to 3. So.
Can I add about the Help Me Grow, because this is what we're talking about today? They do, it's a state agency that does screening and provides coordination of services around social emotional learning for children birth
and they work with older children too. It's not just in the early childhood realm. So it goes throughout school. I don't know. I know it at least goes to older children. I was paying attention in the preschool because that's where I was, but it's a really excellent resource in the state that is underutilized. But is it available statewide or just
statewide? Statewide, and it's part of the larger Help Me Grow initiative, and then we have our Utah. It's under United Way. But what was really cool is they were going through the app. There's an app, so if you're meeting with a family, you could be, and they had needs in certain areas, you could be on the app and like direct you directly to services like filling out questionnaire type of things. So it's a great resource for sure.
Okay, is Utah Parent Center's Amy Hurst here?
Yeah, I'm here. Okay, so we are going to be doing this spring 3 rural trainings on transition from not early childhood, but from high school to post-high, all those kind of things, post-secondary. We'll have the dates, I'll have the dates and locations at the February meeting, but we're excited to get to some of those underserved, more rural areas with this kind of information. It'll be a full Saturday training for the families that come. And then we're starting our book study next month. It's in partnership with the Utah State Board of Education. And the book is Grit. So we did this one last year. And we're doing 2 sessions again this year. And it's awesome. If you'd like to register, you get the book mailed to you, a study guide, and questions and resources. We have room for 150 people, and for our first session, we have 92 already signed up. You join via GoToMeeting at home, so you can be in your pajamas, chocolate or coffee, and the discussion is always really, really good. So the first ones are February 18th, 11th, 18th, and 25th, and then our second session is going to be March 12th, 19th, and 25th. We have a lot going on. Tonight we have the parents as partners in the IEP process in Farmington, if you know anyone. And then we have a family-to-family network. They support people on the waiting list for ESPD. Early diagnosis is early intervention in Tooele. These are all on our calendar on our website. It's really easy to find. We're doing an IEP workshop at Harriman on the 22nd. We're going to Linden for transition to kindergarten on the 23rd. And there's a lot more. So if you want to know about more, go there. And then the Disability Advocacy Day. I think Katie already covered it, but that's a really important day. It's really great to get ourselves in front of the legislature and get a face and a name to disability and the needs of the community. So it's a really exciting thing. So that's it.
Okay. We have vocational rehabilitation. Amy Langoni.
I think the only update I have is what I mentioned a little bit earlier. We are having our Transition Institute that we've been helping USPE with coming up on February 3rd and 4th. And the focus is going to be on interagency collaboration with VR and our education partners. So we're excited about the event because we have national experts coming in, and there'll be a lot of time for team planning and improving our best practices for transition. So if you represent an LEA that has transition teams, please send them to the event.
Okay. Thanks. Next, we're going to have public comment. And I have a comment. Oh, that's Steve.
I had one. Last week I sat down with a couple of teachers, special education teachers who live in the classroom, and kind of talked about like why they were leaving, some of the things that forced them to. And I kind of just, the overall consensus. One of them was they both kind of felt that the large class sizes, they were severe teachers, and they had 15, 16 kids in their classroom, so they felt that wasn't, they were not able to meet their needs under those conditions at all, like even hardly remotely. Both of them sort of expressed their own mental health decline over the few years they taught, and that benefits at the school were not covering their therapy themselves. So the districts, like, they had to pay out of their pocket to sort of look after themselves in that regard. one of the things they talked about though were legislative funds, in particular for special education teachers. Were extremely narrow, so I think each of them got $295, $300 a year for all of their resources, which is the same I get as a regular education teacher. So looking at ways to put more money under the control of a special education teacher, as far as like to allow them, like they would go to the district and be like, can we have money for this in the district? They were always having to ask permission to spend money to meet the students' needs, and they just felt that added a layer, and they were oftentimes they were told no. Even if it was in the student's IEP, they were told no, we don't have the funds by the district. So putting more funds under their control was one of the things they expressed. And then just the overall demand of the job, the massive amount of paperwork they're asked to do, the 2 extra weeks of pay, they were doing, 75-hour work weeks easily every single week. That didn't even total up to the 2 extra weeks of pay. So more increased time off. And then just the role of the district as far as being part of the IEP team and not the iron fist. Like there were several decisions where they said they thought placement decisions were necessary. The team felt placement decisions were necessary, but the district came in and said no. So those were kind of the reasons why they decided to leave.
Interesting.
Can I ask a question? They decided to leave the career and do something completely different, or they just decided to leave
One
that
of them
school?
one of them left the district and went to a different district. The other one just left the professional together. And they were both absolutely amazing special educators, like well above and beyond some of the best I've ever seen in my life.
Have they been teaching a while? Is it new teacher, experienced teacher?
One's been about 15 years, the other one's been like 8 years.
Experience.
So, but what disturbed me the most was that both of them expressed that sort of like they left where they were at basically because they were broken from doing that job for years. So.
Okay, Summer?
I had a couple of people that I'm here to represent share some concerns that they wanted me to bring today, and one was around how state funds for dual language learning oversight looks at children with disabilities and their participation in those programs or exclusion from the programs, and issues with providing special education services while they're in their language half of the day. I've had, because in Cache County, we have had those for about 5 years. I underestimate the age of my child for about 6 years. And those continue to be conversations that people have with me. And we haven't ever discussed that in a group because it's such a little piece of our state puzzle, but it's something that I'm asked a lot about. So dual language immersion courses, classes. And then the other one, I had somebody express to me some concern over the changes in the focuses for professional development in the state away from the multi-tiered systems of support and PBIS to other initiatives, and which I think is kind of pertinent to talk about with kind of what we were used to for professional development in the state with the UMTSS and UPDN providing those things to what is the new structures. And they wanted me to express their concern that the professional development still highlight those multi-tiered systems of support that are available to all students and include those wraparound services for children with disabilities within that instead of having separate initiatives. So that was something
the professional development changed from the UPN to the more in-house, right? Isn't that?
No, not more in-house, just that the providers, now we don't have a contracted organization that they provide the PD. Now we have a contract with an organization that arranges PD and we choose the who that does it. So it could be national presenters, it could be presenters from in-state, it could be ourselves. We have an event planner now not a team of contracted individuals that create and provide the professional development. It's a very, very different model. But the access is the same.
The access to the type of professional development that will be provided should be similar.
Yeah, in fact, it should be increased.
It will still focus on MTSS at least.
So we have state priorities, and the professional learning focuses on the state priorities. And then LEAs have LEA priorities, and depending on their risk for compliance with IDEA, if they have low risk, they can request money to provide professional learning to their LEA based on anything related to their program improvement plan. Anything. If they have high risk, they can request money and support related to compliance with IDEA. That is different. But they didn't have access to any money previously, so the fact that we've given every LEA access to money has actually increased their LEA specific opportunities for professional learning.
Good, I'll share that back to you.
But it is different.
It is different.
Yeah.
But not to be confused with the proposed changes to relicensure.
No.
Yeah, that doesn't have anything it doesn't have anything to do with licensure. And good point, thanks.
Sorry, and can I make a comment? And with it being tied back to the improvement plan, it does steer away from the MTSS, PBIS kind of piece, so it is a different focus for sure.
And that was this individual's concern, is that instead of it being across systems changes, that has evidence behind it to improve other things, that it's more targeted at individual populations that are part of those AYP numbers. And that was a concern that this person expressed to me. So I also wanted to share, I'm a member of the Utah Division for Early Childhood, and we are having a professional development opportunity, or just anybody who wants to participate, from Nate Marsden, who's also a member of the Council for Exceptional Children and does a lot of advocacy work, and he's doing a presentation, I think it's like the 28th, on how to do grassroots advocacy. And I have flyers in the bag back here that I can pass around if anybody's interested.
And he is seriously worth listening to. He is phenomenal. We want him back in our district. They hired him away from us, and we want him back.
Okay, and I have a couple things in my Utah PTA hat. I want to let you know I am, with the high expectations for students with disability, the resolution, I talked to Representative John Curtis's office and sent those to him, and then the person that I talked to is going to talk to him about seeing if there's anything we can do with that on a federal level and see where that will go. Also, National PTA has a legislative conference in March, and they invited me and Leanne Wood to come and present on our advocacy for students with special needs. So we're really excited to get to do that. That's in Arlington, Virginia. And one other thing, with this tax reform referendum, I have a signing booklet. If anybody would like to sign, let me know. I have to witness you signing. I can't pass around for just everybody that wants to, but let me know. I have one of those. Anybody else have any input? Okay, so we have from now until 2
I just
o'clock.
have a quick question.
Oh,
So in our P discussion, I know that there's also a movement towards teacher micro-credentialing, where teachers can kind of self-select different credentials to try and earn. Is there one for things like social emotional learning or supporting students with special education currently that you know of?
So there aren't very many micro-credentials that have been approved.
Okay.
They're being created. There are modules that have been approved related to trauma-informed practices, related to several of the pieces of social emotional learning, and the trauma-informed modules are fantastic. You can actually access them on our YouTube channel, and anyone can access them. If an educator takes them, an educator can get credit towards a micro-credential that we're creating. They're are only a dozen or so micro-credentials that have been approved. So the majority of the work that we're doing is to get the content so that we can then award micro-credentials based on the content. The trauma-informed module content is done and they're excellent. We just finished creating a special ed law, one of 2 courses that will be content for a credential, and that will be available in the next couple of weeks. So we're working on the content, we don't have credentials yet.
Okay. So we have, on our agenda, we have Brian Olmstead's coming to talk about restorative practices at 2, and we need to talk about what our suggestions are for our memo. So we'd like to have a couple different groups, and people can talk in those groups until about 2 o'clock when Brian gets ready to start, and then after his presentation we'll come back together as a whole group and talk about what we talked about in other groups and come up with our list of suggestions for the memo. So the 3 items that we've talked about, access to social emotional learning for those students with more complex disabilities. Then a second group would be recommendations around the 2 models that we heard about today from Juab and Iron counties. And then the third group would be accountability for HB 373 for those with significant disabilities. Those sound like reasonable topics that we want to discuss. Any other input on that? Okay, so Summer, which one did you want to? A group that you'd like to, let's say if you want to discuss the access to social emotional learning for students with disabilities with complex needs, let's have maybe over in this corner. If you are interested in talking about the recommendations around what we heard today, you can be in this corner. And the accountability for HB 373, maybe back in that corner. Is that okay? And we'll just.
Brian just walked in.
Oh. You choose. Okay. Go now and just have him do that first and then, okay. So pause.
Okay, awesome. Yeah, that's totally okay. Do you want to?
Yeah, I'll turn it on.
You're tall, so otherwise I would just do it.
It's my most valuable quality on my resume. I'm tall and little things. I can draw the dots.
Okay, this might be helpful in our discussions. We can talk about restorative practices. Okay.
I was going to say good morning, but that would just reflect my schedule for the day. Good afternoon. So I'm Brian Olmstead, coordinator in student support with USEAP. I have the responsibility for the prevention work, at-risk funding, and then also adult education. Those are the teams that I work with. So Leah talked to me about coming and maybe spending 10 to 15 minutes just talking restorative practices and what we would like to do for you at or from the State Board of Education. So the main thing that I wanted to, I guess the main message, and I don't think this will come as a shock to anybody, but restorative practices, we hope you think of that as not so much as a thing or as a program, but as just a way of being, a way of conducting business, that as it really centers around relationships and community, establishing a safe place for communication. And so when we think about restorative practices, we just, I hope you start to think about and build places where that can happen. It's again, it's not so much a program. Now there's training. We do have training that I have some specialists that we could talk about, hey, could you come out to my LEA? Could you come out to a specific school? They've done that in the past. They'll continue to do that. But it's not necessarily, how do I run a restorative practices program? It's more, how do I implement restorative practices in all of the work that I do? I brought some stuff. I could reference some things. One of the common, I was trying to anticipate possibly some questions. One of the common things that is associated with restorative practices are circles. And so you might have some questions about, is circles, is it necessary? Is that what it is? And it's like, so no, circles are a tool that's often used in restorative practices. Let me read a couple of things here. So, circles, a versatile restorative practice, can be used proactively to develop relationships, build community, or reactively to respond to wrongdoing, conflicts, and problems. Circle process allows people to tell their stories and offer their own perspectives. And so if that's the kind of setting you want to create, then you might use circles. Does it require you to always, gather in a circle? No. I mean, we could say, well, we're kind of in a circle now. I was going to say, we could say we're doing it now, but just any place where you've created an environment where it's safe to talk, everybody can share. That's really the circle concept. Another thing, and we can talk more about that if you want to, because I'm about ready to go to questions. Another thing, well, this is questions. So another tool that's often used and associated with restorative practices are what they call restorative questions. So I'm just going to offer a few of those. If you were to talk one-on-one with a student in a restorative way, you might ask, and so this would be me with an I guess I'd call it a perpetrator, somebody who's acted in an antisocial way, let's say that. So we would question them. We'd say, well, what happened? And get their understanding. Make sure that they understand and that you understand that we're talking about the same thing. So what happened? What were you thinking of at the time? What have you thought about since then? And try to get to the underlying issues of what were they thinking about? How did it affect them? Who's been affected by what you've done? To get that empathy and that relationship between what is often the perpetrator and a victim. And then, what do you think you need to do to make things right? Because that's a restorative concept. It doesn't have to be about punishment. It shouldn't be about punishment. It should be about making things right, learning, and moving on, getting to that next step. There's some questions to have those who have been affected, or if they're the victim. There's certain questions that then you could go down a line of questioning with them. And it's all about, again, communication in a safe way, building relationships, making sure that we're not destroying relationships. There's nothing gained by that. And so as we build community and foster that with our students in our schools, in our communities, we can do that in restorative ways. Maybe a comment about restorative practices, restorative justice. You'll often hear those terms intermingled. I would like to suggest that there's a slight difference. Restorative justice is an example of a restorative practice. It's often used for a specific purpose in a certain time, place, and restorative justice is trying to get to something specifically, the justice for some offense. I would love for you to think of that as an example of restorative practice. And restorative practice, again, is a concept and is a foundational thing that a way of being. One of those ways may be through, or trying to enact restorative justice. But we're really trying to message from the state board that we're about restorative practices. And we'd like to see, just like how we use best practices or evidence-based practices, that idea. We would love things to be restorative, again, to foster that community that we hope and we know that pretty much I think everybody as humans desires that. That's the idea. Everyone wants to belong. Everyone wants to be a part of something good. I think that's inside of all of us. Sometimes that gets lost. And if we can bring people back to that and restore those innate desires and tap into that belonging and community and help people out. So that's my spiel about restorative practices. I'd love to answer questions you have, and I don't know, Leah, you might want to guide me as well.
I think the only other thing that they would really appreciate knowing is the process for an LEA to receive professional learning, like the professional learning that we provide. So
perfect.
The structure.
So we have a new email. I have a team. We're trying to act as a team, so you might see different one of us. There's 6 specialists and myself. So if you email prevention@schools.utah.gov, if you email that and make a request for training, either at the LEA level, at the school level, whatever, just propose what you would like us to do for you, not to you. We don't do that. But let us know what you're seeking, and we'll bounce it back and forth. We'll take it to the team, and we will come and respond in our best way to help you do what you want to do. So that's the way to reach out to us. We are on the website. So the schools.utah.gov, if you just search for prevention, we're the prevention and at-risk team, and all of our individual contacts are there. But the prevention email address, so prevention@schools.utah.gov, is just a perfect way to reach out to us.
And we included in all of the, like a little piece, all of the training that we're providing to LEAs. We're providing some prevention, some restorative practices, some safety, some trauma-informed. Like, we're really trying to make sure that, back to really what Royd was talking about, I mean, the thing that UAB is doing uniquely and beautifully is they're not doing a bunch of different things. They're doing one thing, and it includes everything. They are creating a culture of student support. They don't have a restorative practices initiative and a substance abuse initiative. They have a culture of student support.
I got a quick question. I'm asking you to be probably my only one because I can't.
Because you can't talk.
So is this prevention team now going to, I'm like looking future-wise, gonna start working with schools to develop a culture like they are in these smaller communities? Like,
that's Brian's
is that a big goal? Because I feel like that's what we should be striving for. I mean, right now it's pieces, but I think for a school to like be able to do that as a culture, it's like that's what you ideally are going to offer the kids.
That's so exciting. I'm glad that was your one thing that could come out today. That's exactly what I'm trying to do. So I've gone to Leah with a kind of a vision of a team at the state office, and that's exactly what I'm trying to do, to maybe disconnect everybody from thinking that I have a substance abuse prevention specialist, that I have a suicide prevention specialist, that I have a bullying prevention, and we do gang prevention. We have all these things. We want to act as a prevention team to come and create for you the space to build that exact thing, a culture and a community that supports all of it. And something you'll hear, prevention is prevention is prevention. You've heard that probably all the time for many, many years. I believe it to be true. And I think as we divide ourselves into initiatives and programs and efforts and even funding sources, we're taking away from what could be. And what could be is that blending and braiding of all of that to create the right space for us to help students. And that's what I want to be for you. And I think we've got the right people in place. We just recently, we're a full team now.
I told them you hired
Oh, okay, yeah. So we got 2 new people this week. We feel like we've got the right people in place. So we want to respond to your needs to help you build that culture.
Can I ask you a question? This might be a dumb question. I am a parent of a student, so I'm not in the school districts or in the schools. Is this information out to every LEA that you guys are available, that you're willing to come and train and to help, or is this something that's just kind of getting started and you're getting out? Like, where are you in this process? Yeah,
so great question, because it kind of started a couple years ago and then it stalled because of personnel, and now that she's in the room, I can talk freely. She's awesome.
It's being recorded.
Proceed with caution.
So, yeah, we tied this so much to the person filling the job, and so we've had some turnover in the position, and so then we've had these gaps in not being able to, feeling like we can't reach out because we don't have the person to provide. And so we're finally to the place where we fixed that. Okay. It doesn't matter which one of the prevention specialists you talk to. They should all be speaking with restorative practices, mindset, a trauma-informed care, ideas, and we're trying to get everybody prepared so that anyone could do that. And so right now, this is probably a new message for some people, or maybe a remembering that, oh yeah, and I'll say Gail Threet was the first one hired when we received funding for the position. Gail Threet came to the office and filled that position for a while. And then she got stolen by Jordan. Is Jordan here? Okay, we can talk bad about Jordan.
It's still being recorded.
Oh, that's right. That's right. I forget that. And you're typing. It's great. But she went to Jordan to work on the AWARE grant that they received. And so we've just struggled with that. So does that help answer?
So, but it's something in place now that if we were to pass your information on to LEAs as we come across them, hey, you need to contact these guys. They'll set you up. You're ready for them.
And we're going to start messaging this all over the place.
Awesome. That's great. Thank you.
Okay.
Yeah. So am I right that we're still sort of in the process of LEAs self-selecting, your schools self-selecting themselves for this process, right? Like Absolutely. They would have to contact you. They have to be proactive.
Yeah, it's not a mandated idea or concept coming from the state board. It's very local authority driven, local decision making, that you want to start building things in a restorative practices mindset, or whatever we want, however you want to say it.
And how are we messaging out to the community the sort of results of some of those people who have already, or the school districts or schools that have sort of participating or are currently participating? Is there any sort of messaging back to the community?
Well, that's something that we're talking about now, since I've got the team together. We're talking about gathering best practices, right? Examples of where this has been applied and where it's working well, so that you don't have to take our word for it. You could go talk to those peers and say, well, how did this really play out? And maybe how long did it take? And so we're going to gather those examples. I could point you to a couple. I mean, Davis, Davis for a long time has acted this way. And certain things are in place, structurally now. I could even say culturally, that they just act a certain way. And talking to Davis about what they've done is always a good idea.
Yeah.
Was it?
One more question.
Yes, I think.
I just wanted to make sure that, so how are you getting this information out to LEs about your team?
Yeah, so that's a great question, because we for some reason in our area, we've often used the student service director's listserv. But I look at that list and I'm like, I don't see everybody there. And I've gone to some of the meetings, and it's like everyone's not there, and so I need to know what other lists, I guess, how do I get this out, because we don't have a list of everybody. We have to build lists. The only thing that is maintained in our office really is a superintendent's list and a charter executive director list, so that that top kind of CEO for all of the LEAs. And then after that, it's if a section maintains something, or we use one of the UEM listservs like the student service directors.
It would just be a good place to start, because I've been in education for 20 plus years. It's the first time I've heard that your team existed.
Okay.
Would it be a good thing to go to the USEAP meeting, the special ed administrators meeting, not there, they could pass that on to their
schools and personnel and get connected. Yeah, yes. So would I get that through Leah? Mm-hmm. Okay. Yeah.
I'll tell you where to go.
Okay, any other questions? Okay, thank you for coming. Appreciate it.
Yeah.
Okay, so